It's after 5:30. I'd like to call this finance meeting to order. I'd like resolution to approve tonight's agenda, made by Mr. Denise, second by Ms. Curran. All those in favor signify by saying aye.
Aye.
Aye. Next up is our COVID-19 update, and Dana, I believe you're on the home plate here. If you want to start, you're muted. We can't hear you.
Can you hear me now?
Yes.
Okay, and I think Dr. Williams had some slides. We're going to kind of team do this here. So, okay, so just to give you an update of where we are currently, there are 254 cases since the beginning of the response. We currently have 4 hospitalizations. 240 people have been through the isolation process, and there's been 4 deaths for the county. In the last 7 days, we have had 14 cases, and the graph that you see just graphs all of the cases we have had since the very start. And so we have now been through 4 months of the response. Because this graph gets a little bit small, if you could advance to the next slide. We show it on a weekly basis. And so you can see here in the last few weeks, we have had an uptick. And if you go to the next slide, it shows it a little bit better by kind of cases by day. And during the month of June, we had always shown that we did not have up to 1 case per day. So we had a very low month. And you can see here in this month, we almost made it back up to 2 cases per day, where we really haven't been seeing that since the last week in April. Next slide, please. I just want to give an overview of the cases we've seen by age. And so you can see that kind of younger crowd from the 21 to 30 years is still the highest. And during the last week, most of the cases fell in those people from 0 to 4 years of age. Next slide, please. And when we look at all the cases we've had slightly more females at about 54% of the cases. Next slide. And if we look at how many people have been through the isolation and quarantine process, this is who is just kind of currently in isolation. So we have 10 people. We have 66 people who are in the mandatory quarantine. So those are the individuals who are or who have been exposed to someone who has tested positive. And we have 197 people in precautionary. And so those are the people who, because of the travel, when they come back to New York State, we do help them with the quarantine process. So when you look at the kind of grand total since we've started the response, we have seen more than 2,200 people go through isolation or quarantine. Next slide, please. So just to kind of put this together to understand where we've been since the start and where we are now, since the beginning of this month, so we had 217 cases at the beginning with no one in the hospitalization. 212 people went through isolation, and we had 3 deaths. As of right now, we've had 254 cases. We currently have 4 hospitalizations, and we have 10 people who are actively in the isolation process, which means we contact them on a daily basis. 6 of those 10 people do have symptoms. When we look at all the cases we've had for this month, we've had 37 new cases and 1 death. 10 of these cases have been due to travel from high-risk states. 6 of the cases have been due to a nursing home, which could be staff or just a resident there. We've had 13 cases that were due to one gathering here in the county. And we've had 8 cases due to screening. And so that could be because you're an essential worker or because you were going to have some sort of a procedure. And of the 37 cases, 20 people had some symptoms. And so that's really also something new we've seen in this last month. During May and June, when our caseloads were low, many of the people were asymptomatic. And although we still see that, we have seen more people be more sick. Next slide, please. So when we look at each month of how we have done the response, we know that the first case was on 25th of March. And so we've just kind of finished that 4th month. When you look month by month, cases really rose in that first month, came down. And when you look at month 4, we've now had more cases, and there's a few days left to the month than we saw at month 2 and month 3. You can see too that the quarantines are really starting to increase. So we have placed more than 500 people into quarantine for this month, and 263 were placed into the precautionary quarantine, and that's due to the travel. So we have found out that like an individual comes back to the state and we start the quarantine process. And then 244 of those are placed into mandatory because they had contact with a positive. That's kind of where we are now and where we've been through the response. Next slide. And this is where Dr. Williams begins.
Good evening. So I just want to kind of take things from where Dana left off and talk both about local trends, but also national trends. So if you look at the US, we had 4 days in a row where we had more than 1,000 deaths per day, and reached up to nearly 75,000 cases per day for several days in a row. So this is obviously a worrisome trend. In the North Country region, and when I say region, I'm referring to the 7 counties that are included in the region, not just St. Lawrence County. If you look at the New York State Regional Early Warning chart, you see illustrated pretty much what Dana was describing in our community, which is that in April, we had a large number of cases, some improvement in May, and then June was largely a fairly quiet month. But we clearly have an uptick, not just in the county, but in the region during the month of July. The patterns of transmission really haven't changed. The travelers, I continue to put them in the center of the graphic because I think in a rural community, travelers often end up being the focus of who introduces the virus into the community. But certainly social gatherings, as we've seen and as Dana has illustrated, have played a big role. The other thing we see consistently is that one member of a family is infected. Very frequently, that entire family becomes infected, at least the people who are in that household, especially if no precautions were taken. We still do see the issue with the essential workers and congregate residents, as I think was covered in the local media. So the patterns of transmission haven't really changed. I think when you read the national news and even when we look at things locally, it's easy to become pessimistic, but I did want to point out that there are a few trends in the international community and then locally which provide room for optimism. And I wanted to mention that if you look at Germany, back in April, they had a very prominent wave of cases. They were up at 6,000 cases per day. But then in May and June, they had a significant decrease, which has really persisted. It's a little bit of a sawtooth pattern, and people, if you're following the news, there were some days where they were down in the 100s, and then they did go up to 800 the other day, but largely things are under much better control, certainly than they were in April. And really, if you look at New York State as a state, as a whole, there's a sort of a similar pattern. So we had, April and into May was when our rather large wave occurred. But in June and then even in July, if you look at statewide, we've actually been in much better shape, and certainly in comparison to the rest of the country, a substantial improvement. And I would argue that this is because of the interventions that we know work. So for public health, for everything Dana and her team are doing, the testing, the tracing, quarantine and isolation, workplace modification, and then more recently, travel restriction. Those are key parts of the formula, the toolkit that we know works. And I would argue that that's what worked in Germany, and that's what's worked in New York State. And then the 5 pillars of the community response, which I think are equally or possibly more important. So again, that's wearing a mask. We talk about social distancing, but I think more and more I feel like we should be talking about physical distancing, because I think there's a lot of stress involved in this pandemic. And I think when you talk about social distancing, it probably gives the wrong idea. I think people should socialize. They should socialize at a safe distance with masks. The 3rd pillar is washing your hands. The 4th pillar is staying home if you're sick. And the 5th pillar, which we talked about at the last meeting, is stay local. And those 5 pillars, along with the public health and public policy intervention, we know they work. And I think that's what you've seen in Germany, and that's what you've seen in One of the key pillars is masks. And there's been some discussion about this, and I wanted to introduce a couple of sort of interesting graphics that were published by the CDC. People are probably familiar with the first example, which occurred in March. It was in Washington State, and there was a choir practice. And they had one individual who was symptomatic, sick with COVID-19. They were obviously unaware. During the course of the follow-up, they found that there were about 52 people who became infected because of this one individual. So those 87% of the choir became infected just because of one person. And this was before masks were recommended. If you look at an example with masks, and this was published in July, the case actually occurred a little bit earlier in the year, but this is interesting. So there were 2 hairstylists. They both had COVID-19. Apparently they had some symptoms. They worked with 139 clients. They spent at least 15 minutes with each client, and actually with many of the clients, they spent 45 minutes or up to 45 minutes. When the CDC did an investigation, they found they could not document any cases of COVID-19 among the clients. And they did confirm that both the clients and the hairstylists were wearing masks. So I would argue, as the CDC does, that this is sort of an example of how you can start reopening things. And if you use these precautions, there's a much greater chance that people won't become infected. One of the debates or positions out there is that there's sort of like, this is public health versus businesses. And I think as we've all come to realize that actually the best way to open businesses and to keep them open is to use masks. And this is a graphic put out by Brooke Rouse and the folks from the IDA. And again, I just want to say that I think if you're pro-business, as I think we all are, then you should be pro-mask. Dana, I don't know if you want to speak to this campaign here.
Yeah, so I just wanted to add, so I did share with everyone a few weeks back that we would be doing a campaign. We got in about 45 submissions, and this is one of them. So we're working right now to get some of the billboards just created. We're going to take some of the top ones that were put in to be on billboards, but we're also going to be doing ads in North Country now, just so people see it kind of regularly, and you'll see just many of those that we did receive.
So I talked about this a little bit before. I call it R2P2, which is the Reopening Rollback Prevention Program. And there's certain key elements. And the reason I'm I think this is an important program, is I think we're all concerned. New York State has made great strides. People in the community have made real sacrifices. And I think when we look at the national media, and when we look at what's happening in places like California, there's an appropriate fear that things are going to change and we're going to have to roll back the reopening, which is nothing that anyone wants. So there's certain key elements. And the first key element is the 5 pillars of the community response. The second element is expanding testing capacity. And one thing that people are probably aware of, we've increased testing capacity, but because of the number of cases and the amount of testing that's happening nationally, a lot of the reference labs that we depend on have started having turnaround times. So that means when we send them the specimen, instead of taking 24 or 48 or 72 hours, we have some national labs that are taking up to 10 days to get results back. So that's a real problem. One of the ways that we're getting around this is to increase our ability to do point of care testing. And we're really focusing on doing the point of care testing with a PCR test, which we feel gives the most accurate results and is less likely to have false negatives. The next thing is coordinated and timely tracing, quarantine, and isolation. And that's what Dana and her department have been working ceaselessly on. And then reopening guidance. So I think everyone has on their mind concerns or questions about, our primary schools or secondary schools and our universities in the region, in the county and the region are going to be opening. And I think making sure that they're able to follow the guidances from New York State, and then also making sure that we have open communication so that any local factors can be taken into account. Consistent messaging and education, I think, is critical. As we talk about the 5 pillars, and if we talk about, quarantine and isolation, I think making sure that everyone understands what their individual responsibility is as the community fights the pandemic is critical. And I think having everyone sort of stay on message is an important element. Maintaining hospital capacity. So as you can imagine, back in March, St. Lawrence Health System and also Claxon Hepburn Medical Center made tremendous effort to develop the ability to provide respiratory support for critically ill people. We developed isolation or airborne precaution units. We've really all kept those efforts up because there is this concern about a second wave. And even though it's at fairly significant expense to the hospital systems, the investment that we put there is staying. And then finally, I wanted to just mention regionalism. So I think as we look at the North Country region, we have 7 counties, but we all have one goal. One goal is to protect the health and safety of our communities, and to protect the health and safety of our region, and to make sure that our region doesn't have to have a rollback. So when one county makes a decision, it does impact the other counties. And I know we have people present who are involved in the regional control room. And I think keeping that regional perspective is critical, and hopefully will continue. So just to summarize, there's certainly concerning national trends, and there's clearly an evidence of a local uptick. However, New York State and other nations have clearly demonstrated that these intensive public health measures and the community health response can flatten the curve and can possibly keep the curve flat. Compliance with these different interventions, especially the 5 pillars, I think really increases the confidence of consumers. And as we look at our local businesses and our restaurants and everyone who's really struggling, what I find when I talk to patients or when I interact with other people is they know the places where mask use is enforced, and they feel more confident. They feel more comfortable shopping in places. So I think if we want to help our businesses, if we want to help our restaurants, I think really actively complying, participating in the 5 pillars is critical as we move our economy forward. And just finally, again, we have a toolkit of interventions that we know work. And I think as we're facing what is a potential second wave, we just need to stick to our plan. We need to continue to support Dana and her department, who have been working, again, tirelessly, and do what we know works, which is the 5 pillars and everything from a public health perspective. So that's my report.
Okay. So thank you, Dr. Williams and Dr. McGuire. It's a very comprehensive report. Does anyone have any questions for Dr. Williams or Mr. Reagan?
Dana, earlier you had a chart up there that showed a high level of young people getting infected. It also showed, I think, that there were people much older, that age group, who also were being, less than careful as well. Is that correct?
Yeah, so I think it's the 21 to 30-year-olds, and I believe like 50 to 70, if I'm not mistaken. But it's those two age groups that are kind of older, yes.
Because I think that, we all have a tendency to say, oh, those irresponsible kids are putting everybody at risk. What is to become of us and them? But I think it's just as important to keep the focus on that 50 to 70-year-old group that, can get overconfident and, also expose people as well. And, it's important that we all realize that it doesn't take much to create a problem. The other point I would make is, Dr. Williams, I'm very happy, I think we have to keep focusing on those 5 pillars, and, the emphasis, we all need to make the emphasis on staying local. Here we are, we live in St. Lawrence County, which is the most beautiful county in the world. Has 200 lakes, rivers, we have, right in our own backyard, incredible places, waterfalls, just numerous opportunities to get out, enjoy nature, and learn about what we have. And too often I think people tend to know what's within about a 5-mile radius of their own home. I think that they need to contact the County Chamber of Commerce and learn about what else there is in this huge county we have. And during this critical period, staying local doesn't just mean stay in your house. It means stay here in St. Lawrence County and patronize the amazing places that we have all across this county. And I think that, that is a message that we as the county legislature and the County Chamber of Commerce need to reinforce on a regular basis.
Thank you. Mr. Arquette.
Thanks, Kevin, and I agree with you. This was an informational report. Thank you both the doctors, and this question's for either one. From a regional standpoint, we've noticed some increased cases in Jefferson County. I think today, I believe there was 13 today. Does the group have any indication as to where that increase is coming from?
The increase that we're seeing in Jefferson County?
Yes, ma'am.
I do not know.
Thank you.
I do know that Jefferson County had 95 cases at July 1st. So they have had quite a few cases this month, but I don't know.
Anyone else? Well, thank you for that oh, Mr. Perkins.
Yes. This is either for Dr. Williams or Dana. I've heard from many citizens are asking about the flu versus the coronavirus. Is there any way sometime you could put some numbers together correlating the two? With
Yeah,
illnesses, deaths, things like that?
there was a graph from the CDC that I was thinking about including in my presentation tonight, but we can do that in a follow-up presentation.
Thank you.
And Speaker, if I may just follow up on what Mr. Reagan said. I think, you know, the example of using masks and the hairstylists, to me, is an example of how, with the appropriate interventions, a lot of the things that people want to do are much safer than without those interventions. And so we've seen time and again where when people are wearing masks, you know, they've been protected. And so I think if people are interested in shopping at their local supermarket or, you know, visiting their local restaurant, I think as long as you're following the recommendations and all those things in the toolkit we talked about, people should feel confident and they should feel safe. And I think it's important that people do get out. And I think if there's a good time for a staycation, this is it. And I agree that a staycation is just within our county.
John, Mr. Burke, do you have a question, John? You're muted, I'm sorry.
I apologize. I didn't have a question. Thank you.
Okay, thank you. So I think that's all of our questions. Thank you again, Dr. Williams and Dr. McGuire, for all the work that you're doing for us and keeping us informed. It's been very helpful. You guys are doing a great job. We really appreciate it.
You're welcome.
Thank you. Next up is our county attorney, Mr. Button.
Mr. Chair, would you like me to address the room from here, or would you like me to come up?
But I think probably, because probably half the group can't see you, can you come over here, Stephen? We don't have a mic or anything for him, but he speaks loud enough. Will the people at home be able to see them, Dylan?
The larger question is, will the people at home want to see me?
I'm sure they will, Steve. Can the folks at home, can you see Mr. Button? Okay.
Can you see me now?
Okay.
Okay.
Go ahead. Oh, all right. So our first resolution is authorizing the forgiveness of interest, penalties, and fees on a certain parcel of land to be obtained by the town of Louisville.
So moved.
So moved by Mr. Denisha. Is there a second? Second by Mr. Smithers. Okay, discussion. Mr. Button?
Thank you. The resolution you have before you is a request that was extended by the town of Louisville attorney, Aaron Gustafson. Mr. Gustafson has requested, as a result of a purchase of a piece of property that is 1.9 acres, that the county forgive the interest, penalties, and fees associated with that property, so that the town will pay only those taxes that are delinquent on this parcel. This parcel was scheduled to move forward with foreclosure this year, but it actually did not move forward as a result of not being able to complete the sub-search in time. They consummated the deal with the property owner on County Route 39 and obtained it. According to Mr. Gustafson, this parcel was needed by the town because of safety concerns and a quote-unquote line of sight issue. Specifically, they identified that the parcel neighbors a parcel that is currently town property, that they were concerned about the 1.9 acre parcel acting as an attractive nuisance and blocking motorist view of individuals that may exit from that parcel. So that was the request that was extended to the board.
Mr. Forsythe.
Thank you. Steve, am I correct? The schools and the towns have been made whole by us
That's correct.
all along anyways?
That's correct.
Okay. I for one, will have no interest in this, but thank you.
Mr. Perkins.
Thank you, Mr. Chairman. I am not going to support this resolution as well. Just for the fact that we haven't done this for, well, there was one here just a while ago for the town of Parrishville. We wouldn't forgive the penalties, interest, and fees. I feel as a board, we need to be consistent in what we do. And it's a very small amount. It won't be on the tax roll again, so I won't be supporting it.
Mr. Denisha.
Thank you, Mr. Chairman. For me, as I've spoken before, it gets back to the safety issue. It's the resolution, safer line of sight from the arena. Eligibility for cleanup to reduce risk of injury. For the amount of money we're talking here, if we've got an opportunity to make it safer, I think if we don't do it, we're missing our responsibilities.
Anyone else? Mr. Arquette.
Yes, thank you. I agree with Mr. Denisha for, as Mr. Perkins put, a small amount of money to keep the public safe and healthy is worth that amount of money to me. I'll be supporting it.
Anyone else? Okay, I'll just say my piece. I agree with Mr. Perkins. We have to remember this line of sight was not a determination made by our highway superintendent. This is an assertion made by the town attorney for Louisville that's acting on behalf of the town attorney. So whether the line of sight or actually playground is being obstructed by this property, I think is in question. I've been there, that's where I play hockey, used to play in the league there. This property is I don't think is a problem with the line of sight. The $900 that the attorney, Mr. Gustafson, is asking for Louisville for us to give him a break on is just doing his job. That they can certainly afford the $900. Mr. Perkins is right. Back then, Rick was asking for the same thing, and we denied Mr. Perkins, which it's really a hard time to get consistency on these properties where the towns and municipalities come before us and they request this helpful part. And I believe this property actually should have gone to the tax sale, but the town of Louisville stepped in before the tax sale. This is part of the responsibility in attaining this property is actually all the liens and the taxes that are due. So having said my piece, we'll go to a roll call vote. Ms. Kelly Pearson, please.
Sheridan?
Yes.
Smithers?
Yes.
Denisha?
Yes.
Perkins?
No.
Akers?
No.
Fay?
Yes.
Haggard?
Yes.
Piatto?
Yes.
John Burke?
Yes.
John?
Yes.
Arquette?
Yes.
Terminelli?
Yes.
Curran? No. Reagan?
No.
Forsythe?
No.
Lightfoot?
No.
9 yes, six no.
Okay, so the resolution passes. Our next resolution is the workers' compensation self-insurance apportionment for the year 2021. Moved by Mr. Forsythe, seconded by Ms. Curran. Discussion.
Thank
Mr.
you.
Button.
I apologize in advance. This is going to be a rather lengthy recitation of the events as to how we got here, but in 1956, New York State made it such that governmental entities had the ability to establish their own self-insurance plans. And according to our local law number 1 of 1956 that we adopted, we are required annually to set an apportionment rate associated with each plan participant that is a part of our plan. And every 3 years, we are required to adopt an algorithm. The numbers you have in front of you are for year 1 of the latest algorithm that was adopted. If you recall, earlier this year, resolution was brought forward that adopted that 3-year algorithm, which would cover the years of 2021, 2022, and 2023. Every 3 years, we adopt that algorithm. Every year, we adopt the apportionment according to the formula as applied to the algorithm. So moving forward from 1956, at one point, we had it established such that the apportionment was based off the real property tax values, the assessment values for each individual town and village. Obviously, the county, being the largest plan participant within the system, had the largest amount of land with which to be assessed against. Each subunit of government, the villages and the towns, they had smaller bodies of land with which to be assessed against. In 2017, this board completed the culmination of a process that was started in 2000 to move away from the real property tax assessment and move to a model for our algorithm that was what is in use within the private sphere. That model is based on risk, payroll, and experience. Now, a lot of people have asked me what that formula, how it's actually concocted, how we break it down. As you know, we bring in an expert who actually handles the preparation of the algorithm and the apportionment numbers each year. But I can make it actually quite simple for you, just explain how the process goes in fairly quick recitation. First, we contact all of our plan participants. We ask them for their payroll for the year preceding. That has to be a full year proceeding. So right now you're setting the number for 2021. Clearly we don't have 2020's payroll numbers yet because we haven't had a full year. So we ask for the 2019 payroll. We get the payroll data for all of our plan participants. Right now that's every village, that's every town except for Piercefield and Colton. That's the county and that's the solid waste district. We also provide coverage for our volunteer firemen and our EMS services. Those are included in the apportionment rates. So the first component of that formula from each plan participant. The second portion is what we refer to as the risk. We don't come up with some magical number that assigns the risk per title. The New York State Insurance Rating Board does. The New York State Insurance Rating Board has taken the time-eating process of establishing a code that corresponds with each individual title within payroll. That code has a dollar value per $100 of salary that employee is paid. And that number is supposed to represent the risk associated with that job. Obviously, for someone who does a primarily clerical-based function, their risk is going to be considerably less than, say, someone who's working in highway, a more physically strenuous job that would actually generate a claim against more body parts. I think you understand, but for an example, one of the codes that we utilized this year was a code called an 8810. The 8810 went associated with our keyboard specialists, our secretary ones. That 8810 corresponds to a dollar value of 14 cents per $100 of salary. It's essentially what they assess as a value. Obviously, you multiply against the salary and you come up with a full value for that one specific title. You have thousands of titles within our apportionment formula within the plan. Obviously, because we have every village, we have the towns with the exception of Colton and Piercefield, we have the county, you've got a whole bunch of titles. And you have to look for everybody that was paid during the course of the year. For someone that's in highway, think about it in terms of a value closer to approximately $7 per $100 value. Significantly higher than a value associated with a clerical position, because the assumption of a potential injury is greater due to the nature of the work. The third number that is calculated in there is what we call the experience. So how do we calculate the experience? Some people have confused that with the tail, and I'll set that word over here. I don't want to confuse tail and experience. The experience is reached by looking at how much we have paid for the various claims against that specific participant since the beginning of our plan. We're talking about 1956 when the plan started. So you could have claims that are sitting out there, have been sitting out there for a very, very, very long time, unlike your standard civil suit. For example, let's say Mr. Forsyth in his current position were to walk out of here and get injured. While he would have medical treatment immediately, he would obviously potentially have some loss of time. His claim would stay open because he's currently employed by St. Lawrence County and would stay open until he either separated from employment with the county or we reached some other form of arrangement for closure. If he's an 18-year-old highway worker when he gets injured, and he expects to work until the age of retirement, potentially putting in a 30-year service. It could be 30 years before that claim is ultimately resolved. And for each year in which he's receiving treatment, follow-up appointments, that raises costs associated with the experience. So we take that number and we have our third number: your payroll, your risk, your experience. We finally look at what the overall cost for operation of the plan is. That takes into consideration our administration expenses. That takes into consideration what we anticipate will be our medical expenses during the course of the year. That also takes into consideration what we anticipate those weekly benefits will be, that indemnity payment. And we put that cap. And based on the three numbers for each plan participant, we come up with a percentage of that cap number. What you see at the bottom of your resolution is a number that appears to be approximately $3.8 million, thereabouts. Last year it was more than $4 million. These are what we anticipate will be the complete cost expenses associated with the plan for that specific year. Now, based on those three numbers that are assigned to each plan participant, we come up with a percentage that they will be of that 3.8 for 2021. And that winds up being their apportioned amount. That's how we get the numbers that are before you for each of the plan participants. Like I said, what you have before you represents the first year of a 3-year algorithm period under our local law. If you adopt this and it moves on to the full board, billings will be sent out to each of the plan participants in advance so that they are aware of their cost for participation in the workers' compensation plan. Now, if you'll recall, I mentioned that word, tail. And I said, don't confuse experience with the tail. One of the significant things about workers' comp, as I indicated, is that a claim can live forever. Well, the numbers that you see before you are only designed to cover the expenses of the plan for the current year. They don't cover all of the back years. They don't cover prospective years. They don't cover the tail that is dragging along with the plan. The tail is a debt that is still sitting out there with each plan participant. Each year we have an actuarial firm that calculates out the tail associated with each plan participant. How much liability have they actually incurred and are incurring at the time? How much would they have to cover in order to cover their expenses at 100%? Because these don't represent a full 100% coverage of all of their expenses. Only covers their expenses to a certain extent to what they pay for this year. So when you adopt this, if you adopt this, this formula, this apportionment will represent the 2021 year. Now, speaking of these specific numbers, it was actually a pretty good calculation this year. As you'll notice, two of our largest contributors, both the town of Messina and the city of Ogdensburg, will experience some significant drops. There are two reasons for that. The first reason is that the insurance rating board decided to change the calculation values associated with certain clerical positions. This inured to the benefit of the town of Messina and the city of Ogdensburg fairly significantly. It would have inured even greater to the benefit of the county, but the county is assuming more of the administration costs this year to assist our plan participants in a difficult year due to COVID. As you'll notice, the county is still not seeing an increase above and beyond what its prior year apportionment was. In fact, if you combine both the soil and water number with the county's number, the county will still see a nominal decrease from the year prior. So this was a savings that we could theoretically pass on to the other plan participants that were experiencing a greater difficulty. Other than that, I think you'll find that it was essentially a 50-50 draw between communities that saw an increase and communities that saw a decrease. Most held within a fairly nominal change, whether it be down or up. So it was a relatively stable year.
Okay. Mr. Forsythe.
Thank you, Steve. Thanks for the explanation. The tail. From the year you started as county attorney, do you remember roughly what the tail was?
Yeah, actually I do. When I came in, the original tail we were looking at was estimated to be somewhere around $36 million for all plan participants. Our reserve number, which was essentially cash on hand, was estimated to be, if I recall correctly, and I know Ruth could probably correct me on this if I'm incorrect, but my recollection was we were at approximately $4 million at the time in 2015 when I came in. Now I believe our reserve has elevated to close to $9 million.
Tail.
The tail has decreased to, if I recall correctly, approximately 25 million. So cut about $11 million off in the course of the past 5 years.
And based on these formulas from here out, the biggest driver, besides of course the state rating board change in rate, would be experience. Biggest driver.
That's correct.
So what, any municipality that has good experience, bad experience?
I don't want to ignore the payroll component. Obviously, if you add more people into the equation and you're paying them more money and increasing that salary, you're going to increase one of the three numbers. And that's naturally going to have an impact. If it impacts in payroll, if you've added more titles in, you're obviously going to add more titles into your risk. So I don't want to ignore the other two numbers, but experience is the largest driving factor.
I would say at this time in the county, I doubt that's going to be a huge factor. Yeah, I agree. All right, thank you.
Anyone else? Mr. Arquette.
Thank you, Mr. Chairman. In and along the lines of the payroll, Steve, is the cost of the plan based on total wages or wages up to the value of the plan?
I'm sorry, Tony, you dropped out there at the end of your question.
Is the cost of the plan based on total wages or wages up to the value of plan? In other words, there's the 2/3 component where if somebody making $2,100 a week would receive 2/3 of the plan, or 2/3 of that amount, which is $1,400, close to $1,500. Whereas somebody that's making $1,400 would get that same amount because you know the ones making $2,100 are actually entitled to $934. As opposed to there's a $699 difference. So I guess, you know, basically what the question is the cost of the plan based on the cap, which is set, that would not allow that person to make $934 via a workman's comp, again, relating to the payroll portion. There's $699 left on the table. Where does that go?
So let me go ahead and break down essentially what Tony's question is asking for those who aren't familiar with workers' compensation. So when an individual gets injured on the job, one of the first things the employer has to do is prepare up what's known as the average weekly wage. And you'll go ahead and take a look at the 52 weeks preceding the injury, and you'll identify what they made as an average per week. There is a cap that has been established by New York State, and that cap sets the value of the amount that can be paid in indemnity to an injured worker at a certain amount per year. For example, in 2019, the number was $904. A worker, even if they made $20,000 a week, could make no more than $904 per week in workers' compensation benefit. So I believe the question that Tony is presenting here is the plan based off of that 904, the maximum cap that could be assessed per worker that is included in our plan apportionment? The answer is no, Tony, and I'll explain. The indemnity portion represents only a small fraction of the cost of the workers' compensation plan annually. The workers' compensation plan for the indemnity portion really represents essentially 1/3 of what our expenses are annually. You've also got the medical, and the medical ends up being actually the larger amount that you spend on. Let me give you an example. Once again, Mr. Forsythe walks out of this room this evening and he decides to break his ankle, slipping and falling. We'll say he decided. It was an accident. He slips and falls and he suffers a workers' compensation injury. As a result, his doctor tells him he's going to have to undergo the knife and he's going to have plates and screws inserted. He'll also have follow-up visits. He'll have x-rays that will have to occur. He'll have nurse practitioners that will be assigned. The process for recovery is projected at being approximately 6 months with average swelling of 18 months to 24 months after his injury. For the 12-month period immediately following his injury, he may only receive the maximum cap of, say, actually, I don't know how much you make annually, but let's assume that you make about $15,000 as a legislator. If you made about $15,000 as a legislator, your average weekly wage would put you down probably about $80 a week for your benefit. That's your indemnity portion. But your medical spend during that time period would probably be closer to $85,000 to $90,000 for your surgery and your follow-up. Your administrative costs during that 12-month period for the management of the plan, for a hospital nurse that would be assigned to review the medical treatment, could be another $50,000 to $60,000 of medical expenses to the plan separate. So you're talking about what the administrative costs of about $50,000 to $60,000 and these $87,000, $85,000 of medical expense. You're talking about $145,000. Now, the average weekly wage, or the cap that he would have obtained during his time period that he was out, wouldn't have exceeded his $15,000. But we would have spent, in addition to that $15,000, roughly $150,000 to cover the medical and the administration. If you were to establish the program or the apportionment solely on the basis of the indemnity, it would work an injustice to the plan that would not account for the full expenses that would be floating out there associated with the administration and with the medical. Did that answer your question, Tony?
Absolutely, and I appreciate that.
You got it.
Okay, anyone else? So all those in favor of the resolution signify by saying aye.
Aye.
Opposed? Okay, resolution passes. I'd like the county attorney to comment on the emails that we've been getting from San Carbone. I believe everyone got those. And comment about what's been happening there in our negotiations or our contacts with the town of Messina and what they owe us in compensation.
Thank you. I think the board is completely aware at this point that in 2020, the board established, 2019, the board established the apportionment formulas associated with the plan participants that were to take place in 2020. That 2019 apportionment numbers were based off of 2018 payroll. Included in that 2018 payroll for the town of Messina, obviously, was Messina Memorial Hospital. They had not privatized at that time. Earlier this year, we received approximately $125,000 in payment from the town of Messina. The town of Messina indicated that this was to represent the town and the MED, or Messina Electric, portion of their apportionment. It was a fairly significant amount of apportionment. Messina is our second largest employer in the municipal pool. The town was notified in April by telephone call that they remained delinquent and asked what was going to occur with respect to the repayment plan. At that point, no plan was made, and the board was made aware that there was a delinquency. Obviously, we've had several discussions at this point attempting to discern as to how to move forward. I will note that this has been an ongoing conversation that long predates January of this year, and I think that's important that we get that out there. In fact, I thought it was so important that between my confidential secretary and myself, we went back through all of our emails for the past 4 years to pull out all of the data associated with the contact that we have had both with their experts, their attorneys, and with members of Messina Memorial Hospital to make them aware of what their obligations were to the county under the plan. I will note that my first discussions with them took place in October of 2017. In fact, I took the liberty of sort of drafting up a sheet. And in 2017, at that time, Messina Memorial was already looking potentially at privatizing and was asking the plan for information associated with the loss runs as well as their actuarial data. On October 3rd of 2017, we sent that to Messina Memorial Hospital so that they had a clear understanding of what their loss runs were, how many claims they'd had, what their experience was looking like. On October 13th of 2017, we received contact again from both the hospital as well as from the town, asking for additional loss run materials, as well as the Milliman's report, that actuarial report that I talked about that identifies the tail and gives the background. We sent that at that point. On October 26th of 2017, we actually had communication with an outside attorney hired by the town, as well as with their town attorney, Eric Gustafson. And we explained, understanding the trailing liabilities related to the hospital, what the costs were, that debt was debt that was going to continue to carry on unless the town and the hospital made some type of arrangement for how that was going to separate at the time of privatization. On October 27th of 2017, we once again sent the actuarial assessment, this time enlisting Joe Peckham, our outside expert, to actually send over the Milliman's report so that they were aware of what the information was that they needed to be dealing with. Again, in June of 2017, we sent additional information to them. On November 1st of 2017, we actually broke down the 2018 numbers for MMH, identifying where the injuries were, the propensity for injury, the risk associated with the specific that were regularly getting injured, the value of MMH specifically to the town's apportionment plan. That was sent from Joe Peckham, once again, to Katie Centolella, Jason Centolella, and Eric Gustafson. On February 16th of 2018, we received contact asking once again for the loss runs for the town and for the hospital. We did that and provided that to Key Bank. At the time, there was a review that was being performed for potential privatization of their own insurance coverage. On February 27th of 2018, I sent an email out associated with a payment plan that we had to establish because the town had been delinquent in that year, hoping that the hospital was going to cover something separately from the town. Much like they've asserted this year that the hospital should have been responsible for their portion. In 18, that was an argument that they made, and the plan informed them that under our local law, the town as an entity is the plan participant. The hospital would be viewed just like another department would be. If highway in St. Lawrence County stopped existing tomorrow, that wouldn't excuse the county from being responsible for the county's portion. That just means that we're covering employees that are no longer with us. That's what happens when there is a separation. In November of 19, we once again got information from Pat Facto, from Eric, regarding a request for loss runs for MMH, and we provided that information to them. On December 16th of 2019, so you're talking about approximately 15 days prior to the announced privatization of MMH, I sent an email out to the attorneys associated with the town of Messina that included all of the actuarial data associated with both the town of Messina and the hospital associated with their risk of loss. Now, since 2017, the county has provided the algorithm for 2018 through 2020, the algorithm for 2021 through 2023, the Milliman's report for 2016, 17, 18. The MMH open and closed loss runs 4 times. The local law, number 1 from 1956, local law number 2 from 1956, local law number 2 from 1990, and local law 3 from 1993 as well. And in addition, the county has provided the MMH claims data broken down according to cost, as well as the town's exposure data on each request that has been made by the town or their representatives directly to the county and the plan. We have also made our expert available to speak with their experts. Our expert, Mr. Peckham, has met with not only their expert, Tony DeMano, but their expert, Kathleen or Katie Centolella, not once, but 3 times. And we have explained the tale not once, but 3 times as well to the town of Messina. So we have really gone out of our way to try to be open and transparent and provide information to the town of Messina as well as to MMH to assist in the transition from a governmental entity to a privatized organization. So I know that you have probably seen a television story about it. I know there were questions about the process. So where do we stand right now? Right now, it's my understanding that the town still owes the county approximately $900,000 that's still outstanding. I know that the town is waiting for additional information. In fact, when we sent them the notice of default on June 17th of 2020, we notified them that they had until June 30th to tell us as to what their option would be for repayment plan. On June 30th, we received contact from them in the form of a letter that indicated that they would comprise a response once they had received the 2021 apportionment, which has just been voted on, as well as when we provided them the actuarial data that I referenced from our prior communications. I have compiled a letter that will also accompany all of the emails as well as the flash drive that includes all the prior documents that have been provided to the town of Messina over the course of the past 4 years with respect to their request, and hopefully that will go out tomorrow, now having approved the apportionment. But we really have certain limited options. Under the law, under workers' compensation law, section 67, we have the option of actually passing a resolution and having the board actually apply or re-levy that amount of unpaid apportionment from a plan participant against the tax, the residents of that specific tax district. That's option number one. Option number two is that the town obviously can borrow to make good on their debt with the plan. And there has been some discussion with the town about the possibility of them borrowing against the reserve at an interest rate or actually going out and bonding for themselves. Finally, they could actually talk about some of the revenue that the county shares with them and allow the county to retain a larger portion of that. They could voluntarily enter into an agreement whereby the county withholds a portion of the sales tax distribution that would normally go to Messina under the prior agreements. But as it stands right now, I believe they are expecting that I will get a response to them, and there is a response that I expect will go out tomorrow.
So a week ago or 10 days ago, you sent out a notification that Messina was going to send us a check for $199,000. Have we received that?
Not to my knowledge.
So you haven't got it, Ruth?
Not seen it.
Have not seen it. So I would ask the representatives from Messina, Tony, do you have an answer to that? The $199,000?
I don't, Mr. Chairman. And I'm the type of individual, I don't like to be repetitive, and you've all heard me say this in the past. First and foremost, I'd like to thank Attorney Button and his staff for doing what they can to help Messina out with this situation. But I also want to remind everybody of the fact that this transition with this hospital is an unprecedented situation. That hospital served far more than the town of Messina. Many of the villages in and around and towns utilize that, and it was the magnitude of that transition was unequaled in the history of the county. Secondly, even though, not to bring apples and oranges into this, but our sales tax generation over decades and decades, Messina carried the water for a lot of villages and towns that were fortunate enough to experience the benefits of that revenue generation. So I just ask the body that you keep that in mind as we try to provide some type of leniency or some type of consideration for those things that we mentioned, and that we work with and alongside Messina to get this resolved. I appreciate that.
The premium is no reflection of whether the hospital is in business or not, correct? Is the premium owed the previous obligation?
The premium is, as I indicated, for 2021 is representative of the 2019 payroll. In 2019, the hospital was fully a part of the town, so that would have been included in the calculation associated with that premium. Once again, these numbers only address the premium, they do not address the tail, and the tail is a separate issue. But assuming as long as the town is a plan member, there is no interest in the plan calling due the tail. And I think the board, at least as far as I understand, has been interested in trying to find a way to work with the town of Messina to find some type of resolution to move this along. At least that's been my understanding.
Okay. Well, thank you for the rendition and the history. You have a question, Mr. Burke?
Yes, Steve, would you make sure that we get copied in on the correspondence between Messina and the county?
Mr. Burke, I intended to put everybody in the room and everybody at home on notice of that correspondence. I hope you'll understand the attachments that are going to go are about 500 pages of documents that have previously been provided, but we're providing them again. And I will spare you all your mailbox of the 500 pages of extra documents, but everybody will get a copy of the main correspondence.
It's the correspondence as well, Steve. Apparently there's reference to correspondence from Sam Carbone, and I, for one, didn't receive any copy of that, and I believe there are others as well that didn't. So I would like to be copied in.
Mr. Burke, I have to admit that I was not a direct recipient of the Mr. Carbone emails as well. They were forwarded to me, but I believe they were directed to other members of the body.
Okay, well, whoever received them should share them. Thank you.
Yes, sir.
I think the people that represent Messina, I think Nicole, you've got, Ms. Terminelli, you got it, and Mr. Arquette, and actually Ms. Curran are the recipients. Is that correct?
Nicole had a question.
Well, I'm saying, Nicole, Ms. Terminelli, did you have a question or a comment?
I did. Steve, do you offhand know what the 878,000 for next year's apportionment? Do you know the dollar amount attached to MED versus and the town employees versus the hospital portion?
To be honest, we did not do that breakout this year. We had done it previously in prior years because they had explained to us that that was for a budgeting and billing purpose. We probably very easily could break out the hospital's portion of Messina's. And I think you'll actually find that the hospital's portion is a significant amount. It's the largest component of their apportionment each year. As I think I indicated before, Messina's going to see a significant savings next year, which is the first year in which the hospital will no longer be included in either the payroll component or the risk component, because those titles will drop out in the risk component. It'll be still included in their experience component because that's the look back and you see how much you expended. But if you would like me to, I can ask our outside expert to break those out.
Yeah, and I would appreciate that. And one more follow-up question, just what if is Messina Hospital carrying workers' comp on their own workers right now? Like if one of their employees got hurt today, that claim would be filed under Messina's or St. Lawrence Health System's workers' comp, not against St. Lawrence County self-insured plan, correct?
Yes and no. So let me explain. One of the difficulties with hospital claims is that the hospital claim can arise years after the incident actually took place. Let me explain. You're a nurse working at a hospital. You accidentally prick your finger on a syringe. You don't report it as a workers' compensation claim. You don't think to. 3 years later, you get diagnosed with HIV. That's traced back to an incident that occurred in 2017, 2018. The claim would be apportioned against the employer that was covering at the time. That would fall back on our plan. That's why you wind up with a significant insurance rating board code associated with certain medical professions, is because there's the potential for what they call the sleeper claims. These claims that may not pop up for years and then all of a sudden they relate back to a year in which the employee is so far removed from that you don't even recall them actually being employed by the employer. So I don't know if that answers your question, but I'm hoping to explain that it's possible that claims could arise right now that would relate back to an incident that occurred several years ago. It is possible that if it is your standard slip and fall where they break an ankle, that's going to fall against their workers' comp carrier who's carrying right now.
Okay, thank you.
Okay, Mr. Forsythe.
Steve, You mentioned the cost, the apportionment. What about the long-term tail? Have we calculated what the hospital's portion would be long-term?
We have an actuarial assessment of what that is, but I would want Mr. Peckham to see that a little more closely before announcing that number. I'm not completely comfortable yet declaring what that is.
But somewhere along the way, we're gonna have.
It's a substantial number, but once again, assuming they stay as a part of the program and assuming we continue to do what we're doing. I think the board should be very proud that over the course of the past 5 years, as a part of the strategic process that was engaged in 16, 17, and 18, the reserve has gone up. The tail, at least with the entire plan, has gone down. This has been a massive accomplishment, and it's a swing of roughly $14 million. That's massive.
Yeah, and now it's based on what the insurance industry bases.
Yep.
Anyone else? So Steve, these bills go out for worker comps to the municipalities when, in January?
It's my understanding that the county treasurer sends them out earlier than that, but I'll have to confirm with her.
And typically, do you know, or Ruth, do you know when most towns make their payments? Probably after get their tax money?
I think there are a number of answers to that question. We can get you a list if you'd like.
What would be the average? Would be sometime in April? I mean, it must be in April if you actually call them to ask them where their money is.
I think most are received in the first quarter. You can certainly
Okay.
see how many are left into the second quarter as we're just
Yeah.
wrapping that up now.
Well, I find it alarming because Messina represents 25% of the actual premium. And they're in arrears. We've been promised $199,000. We haven't gotten that. And then we talked to them probably a month ago. Tony was in on the call and others about what they were going to do. And they talked about bonding, borrow against the plan. And I think that they need to move, obviously, from your rendition of everything, that's the number of contacts that you've made from 17 on, that they need to be, I think we need to move forward and come up with a resolution if we don't get satisfaction, so. Okay, Ms. Curran.
So at their town board meeting last month, they did pass a resolution saying that they would pay that $199,000.
Okay, but we don't have that. Yeah, okay.
But it's on the, you know what I mean, it like actually was talked about and they voted on it to pay it, so I'm not sure where it is.
Okay, thank you. All right, thank you, Mr. Button. Mr. Burke?
Just once again to go back to the point that if you expect all of the legislators to be part of the solution, we need to have equal information as to what has transpired. It's very difficult coming in, seeing what we see on the news and not being informed of all the correspondence. So again, I would ask that anything that you expect the full board to act on, I don't mean you personally, Kevin, whoever's receiving the correspondence, that you share that so that we're all on an equal basis as far as information.
Thank you, Mr. Burke. And Mr. Terminelli?
Just one question about Messina's proposition to repay or to become whole on the amount that they owed. Is it correct in saying that they were waiting for this resolution of apportionment for next year to be passed before they made a final decision as how they were going to proceed?
I assume the question is posed to me, Mr. Manali?
Yes, sir.
Yes, that was part of their request. They had requested the 2021 apportionment number so that they could at least figure out if there was a larger number they were going to have to deal with collectively, and they had also asked for the actuarial data associated with the algorithm. And I think my recitation indicated that had previously been provided several times.
So they'll be notified of that amount, or they'll know it as of tonight probably to be able to plan forward.
Yes, Legislator Terminelli, obviously I don't have the ability to set the rates. That's up to the board by law. And so I didn't feel comfortable setting on the rate associated with the 2021 apportionment until the board had taken action. My letter will reference that number is a tentative number subject to full board approval on August 3rd.
Thank you.
So just one comment, Mr. Burke, the information that we've been talking about was forwarded to me today. I actually have not had a chance to read thoroughly through it, but it was basically, I believe, an email from Sam Carbone to Ms. Terminelli, Mr. Arquette, and to Ms. Curran. So I think, Mr. Arquette, would you like to comment? Then we'll move on.
Just the fact I was under the impression that we were in a negotiation with the representatives of Messina and the leadership of our board. And I was unaware that Mr. Carbone had sent those emails anywhere else, but to the people I just spoke of.
Okay. Okay, thank you. All right, let's move on. So our next resolution, thank you, Mr. Button.
Yes, sir.
Is authorizing the chair to sign an agreement with the New York Power Authority for the installation of a culvert on County Route 39 to facilitate the Smart Path Moses Adirondack Transmission Lines project and to modify the 2020 budget for the Department of Highways. Moved by Ms. Curran, second by Mr. Denisha. Do we have?
Yes, sir. Mr. Akers? This resolution is to allow us to enter into an agreement to install a culvert under County Road 39 in relationship, as the resolution states, to the Smart Path project. Basically, it's going to allow primarily the Blanding Turtle safe passage under the road to mitigate some of the mortalities that of Blanding turtles have experienced in the area.
Okay. Mr. Arquette.
Thank you, Kevin. Could I be abstained from voting on this issue due to my
Certainly.
primary?
Yep, and Ms. Terminelli, you also?
Yes,
Okay.
please recuse. Thank you.
Okay, thank you. Any questions for Mr. Chambers concerning this project or this resolution? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed, motion carried. Mr. Arquette and Ms. Terminelli are abstained. Our next resolution is approving a supplemental agreement number 2 with McFarland Johnson for additional services for South Shore Road Bridge over the Oswegatchie River, bin 334940, pin number 775371. Moved by Mr. Denisha, second by Mr. Sheridan and Ms. Curran. Mr. Chambers.
Yes, this resolution is for a supplementary agreement with the consulting firm that we had selected to do the design for the South Shore Bridge. And as of late, we did have a issue with the north abutment. The bedrock, we took a boring, found the elevation of the bedrock. However, the bedrock was on approximately a 45-degree slant, and a sub-footing needed to be designed and drilled and pinned into the bedrock. So that took additional engineering and submittals to move this project forward. So this will be covered by federal and state funds to the tune of 80% federal, 15% from the state of New York, and 5% by the county. And the project will still remain within budget, even with the changes.
Okay, any questions for Mr. Chambers concerning this resolution? Seeing none, all those in favor of the resolution signify by saying aye.
Aye.
Opposed, motion carried.
Thank you.
Our next resolution is solid waste. It's modifying the 2020 solid waste department budget for overtime. Moved by Mr. Burke, second by Mr. Fay, I believe. Mr. Chambers.
Yes, this resolution addresses our shortfall in the budget for addressing overtime. I think all the legislators are aware that normally during the budget process, a percentage is set aside for overtime. We will be exceeding that amount by the end of the year, and therefore the reason for this resolution. But one of the overriding factors that has really driven our overtime costs, especially in the first quarter, was a result of hauling our recyclables to Liverpool, New York. In the previous year, a lot of our recyclables would have went to Casellas and Potsdam, Hanwha area. And we were actually hauling them all the way to Syracuse. And we also picked up additional, basically doubled our tonnage of recyclables that we're currently moving. With all the recycling in the county now being handled, its final transport being handled by county forces rather than some private forces as well. So those are the primary reasons for our overtime usage.
Okay, thank you, Mr. Chambers. Any questions for Mr. Chambers on this resolution? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed? Okay.
Thank you.
Thank you, Don. Thank you, Don. Our next resolution is authorizing the chair to sign a contract with Northern Lights Healthcare Partnership, Inc. for home care services in the expanded home services for the elderly program. Moved by Ms. Curran, second by Mr. Forsythe. Discussion, do we have Andrea Montgomery? Go ahead.
Hi there. Sorry if it's a little windy. I'm actually doing what Dr. Williams said, and I'm camping this week. I didn't intend to have a resolution on it for finance. So I apologize if it's a little windy. I'm at Higley, right in St. Lawrence County. Anyway, this is a resolution authorizing us to sign a contract with Northern Lights for our home care. Currently, we have a contract with United Helpers, but United Helpers has bought Northern Lights, and they are merging all of their home care services under the Northern Lights umbrella. So in order to continue operations and continuity of services for our clients, we need to sign a contract with Northern Lights. This was one that we weren't given a lot of notice on. As soon as they receive their operating permit through the Department of Health, we'll have 30 days to get a contract signed, or we would have approximately 12 clients who would have lost their aids. So I thank you all for letting me appear before finance to get this acted upon quickly.
Thank you, Andrea. Any questions for Ms. Montgomery concerning this resolution? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed? Motion carried.
Thank you. Have a good night.
Thank you. So vacancy committee, Ruth, are you taking care of this, or you just want me to mention that, or?
The department heads are prepared to speak to each request.
Okay. So, Mr. Chambers, would you like to talk about the motor equipment on highway?
Yes, this position is for our highway maintenance shop. Our department maintains all the county vehicles and equipment, including solid waste. This position is an assistant mechanic, basically, and was vacated by the county employee that took another position within the department. That's how the vacancy was created. This position, especially with the partial shutdown of our maintenance facility for a number of weeks here, is very important to help us get back on track as far as equipment maintenance and services. Again, very important. Keeping the equipment and vehicles moving is vitally important to operations.
Okay, anyone have any questions? Okay, seeing none. Thank you, Mr. Chambers. Next up is real property, and it's a real property tax services aid. Mr. Green.
Yes, thank you, and good evening. One of our 3 real property aides in the office is retiring the end of next month, and I'm here to ask for that position to be filled going forward. Someone that's worked for the county for over 17 years and just looking to fill that position. The real property tax aid works as an aid for each of our towns out there, and they work closely with the assessor of those towns in key information for that municipality. So we're looking for to fill that position for next month.
Okay, thank you, Mr. Green. It sounds like a herd of horses are going through your kitchen. I don't know what the noise is.
Oh no, well, sorry, there's just a fan on, so maybe that's what it was.
It's a roundup in Lisbon. Okay, any questions for Mr. Green? Okay, seeing none, thank you, Bruce.
Thank you.
Okay. Sound like horses to you? Okay, so next up is a resolution in opposition to New York Senate Bill 8676 and Assembly Bill 10780, which would require police officers to maintain private liability insurance and exclude police officers from provisions providing defense and indemnification. Moved by Ms. Curran, second by Mr. Denisha, Mr. Smithers, Mr. Sheridan, Mr. Lightfoot, Mr. Forsythe, Mr. Reagan. Any questions about the resolution? It's pretty straightforward. Okay, Mr. Lightfoot.
Just a comment or two. I think that it's a good resolution. Removing indemnification from police officers is going to have a chilling effect on how they do their job, or how they don't do their job, or how they won't be doing their job. They're not going to be out there taking the extra step, going the extra mile, trying to enforce laws that somebody along the line has made a complaint about, burglary to their house, a larceny of their car, or their chainsaw, or you name it. They will follow a strict protocol, I will tell you now, and if they run into anything at all that gives them a reason to pause and stop before they do something, cases aren't going to get solved. People are not going to be punished for their transgressions. Property will not be recovered. And add that to no bail and catch and release. We're setting a hell of an example, folks, a hell of an example. Take a look at what's going on out in a couple of our western states, where the police chief went on the air today and said, I can't send my officers out to enforce the law because there is no backing on the part of the city fathers, the city council, whatever they're called. So she has essentially told rioters that they've got free rein. It'll be very interesting to go home tonight and see what's going on in Portland and those other cities out there. So it's be careful what you wish for. I don't think that this is, removing indemnification for a police officer is a very smart thing to do, much like bail and revoking that. I think that it will rue the day we did a lot of these things.
Thank you, Mr. Lightfoot. Anyone else? Okay, Mr. Reagan.
Mr. Chairman,
Would you turn on your mic, Jim, please?
Oh, sorry.
Thank you.
Mr. Chair, I just want to applaud you for introducing this. I think it's very important that we, as a county legislature, send a message out there that we are not just behind our law enforcement community, but we are actively opposed to this systematic campaign of harassment and intimidation against our law enforcement community. Recently the state legislature also, in addition to the bail program, which I believe is non-reform, was effort to, which is resulting in making our communities less safe, but they also passed a new law that opens up disciplinary records about our law enforcement community and makes no distinction between actual founded cases and complaints. When a police officer makes an arrest, as hard as this is to believe, there are some people who don't appreciate it and who make complaints and who feel that they should be exempt from the laws that apply to the rest of us, and they will go out of their way to seek retribution on the officers who they feel targeted them. And that is opening it up so that, lawyers can use that to tar and feather the reputations of good police officers and convince a jury that it was, the police department's fault. And as someone who spent many years covering trials as a news reporter, it's well known that, when you're guilty, the best defense is to attack, and that's what a good defense attorney does. And we are now providing a lot of baseless accusations that can be used to help further that cause and damage the reputations of hardworking officers who do nothing but risk themselves on behalf of the citizens of our state. And I think it's important that we, as a legislature, stand up for them and say, this is unacceptable.
Thank you, Mr. Reagan. Mr. Forsythe.
Yeah, I'll be short. I'd just like to thank you for bringing forward this and the next resolution, really. Just show law enforcement we got their back. I can't imagine St. Lawrence County being in the state of disarray some of these larger cities are going through now. It's just, to me, it's just gone way beyond comprehensible. My question would be for the county attorney, is New York State Bar Association, are they in favor, I'm assuming their lobbying group would be in favor of this, or have you heard any one?
The emails that I have received from the New York State Bar Association would appear to support both the 50A repeal as well as certain other reform measures that have been advocated for law enforcement. I don't recall having seen anything where they take a position with the defund movement, but I do recall them having sent out an announcement in support of the 50A repeal.
Okay, because in mine, the insurance industry, I haven't heard any mention of this, so hopefully it's just gonna be a mess, so thanks for bringing it forward.
Anyone else? Mrs. Haggard.
Thank you, Mr. Chairman. I support this resolution. I don't think we should ask people who put their lives on the line to have to pony up the money for this insurance. It seems like maybe this is something that wouldn't apply to our area as much. I have great respect for the law enforcement in St. Lawrence County and generally, and particularly, I think that asking them to do something like this would be, as many people I think will say, we won't be able to get people to do this job if they were required to do this. So thank you for the resolution.
Thank you, Mrs. Haggard. Mr. Perkins.
Thank you, Mr. Chairman. I fully support this resolution, and I'd like to be added as a co-sponsor, please.
Okay. So noted. Okay. Mrs. Curran.
Yes, I would also like to be added as a co-sponsor. And I want to say that,
I'm not sure where they're coming from and thinking they should have their own liability insurance. These are the people that run into burning buildings to save us and dive into water, you know, to help people and all kinds of other things, and I don't think it's a reasonable attack on them.
Okay, thank you. Anyone else? Okay, seeing none, no more questions, let's do a roll call.
Smithers?
Yes.
Denise? Perkins?
Yes.
Akers?
Yes.
Hay?
Yes.
Hager?
Yes.
Piacco?
Yes.
Burke?
Yes.
Arquette?
Yes.
Terminelli?
Yes.
Curran? Yes. Rankin?
Yes.
Forsythe?
Absolutely, yeah.
Lightfoot?
Yes.
Sheridan?
Yes.
15 yes votes.
Okay, thank you, everyone. Our next resolution is discouraging local units of government from defunding or abolishing their police departments. Moved by Mr. Lightfoot, seconded by Mr. Nisha, Ms. Curran, Mr. Forsythe, Mr. Reagan. Okay. Any questions concerning the resolution? Ms. Haggard?
I'm sorry, Mr. Akers, is this questions or comments or just questions?
Discussion, comments, questions, yes, all
Okay.
above.
I have a comment and I'd like to propose an amendment. I really hate this term defunding the police. Unfortunately, it's taken on some kind of meaning that it just doesn't make sense. I would like to propose, I think we have a great opportunity to show a unified board. If we were to remove the first whereas, it would remove any politicalization of the resolution, and it doesn't advance in any way the issue of not defunding the police. I am in favor of the resolution, but would ask that we consider eliminating the first whereas. Thank you.
I would second that.
Okay, so we have a first and a second. Discussion on the amendment. Mr. Smithers.
I thank you for not wanting to make this a political issue, and probably a good idea to not emphasize that, so I would support that.
Okay.
We can be unified.
Okay. Anyone else? Mr. Denisha.
Thank you, Mr. Chairman. Yeah, I think if we've got the opportunity in front of us to show our support as a board for our law enforcement agencies, I think it's a good idea. You know, as I had commented to you earlier, admittedly, there are bad apples in every profession. Bad apples in every race, every religion. But the actions of a few bad apples shouldn't be used to define and judge everyone else.
Thank you. So, as the sponsor of the resolution, I'm fine with that. Actually, the words justifiably drawn attention, I thought I was part of it to actually make it more amenable for a bipartisan support. So I'm fine with pulling out the first whereas. So any more discussion about the amendment by Mrs. Haggard?
Mm-hmm.
All those in favor of the amendment signify by saying aye.
Aye.
Opposed?
No.
Okay, one no, Mr. Lightfoot. So we have the amendment resolution in front of us. Any further discussion about the amended resolution? Seeing none, let's do another roll call vote.
Kevin, is this for the amendment?
This is since the amended resolution passed, the amendment has passed. So now we're talking about the resolution with the amended resolution. If you had questions, you missed your opportunity. Would you like to make a comment? Okay. So I think we're ready for a roll call vote.
Excuse me, Mr. Chairman.
Perkins,
I did have a question. Is it too late
I'm sorry.
for discussion? Yeah.
Look, let's talk to our, just a minute, let me converse with the parliamentarian there, our county attorney.
Vote is technically started, so.
Okay, so the vote is technically started, so I don't know how to reverse it there, Rick, so.
Clap your hands and have you look closer. Okay, that's fine.
Okay, sorry, I really apologize, I can't, you're in my peripheral vision here.
Mr. Chair, I would remind that this will come back up at full board meeting, so you have an opportunity to comment at that time.
So Mr. Button says that we'll be at the full board, and then Rick, if you want to amend it at that time, we can bring it then. Okay, thank you. So would you continue?
Perkins,
Yes.
Akers,
Yes.
Hay,
Yes.
Haggard,
Yes.
Bianco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran, yes. Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
15 yes votes.
Okay, thank you, everyone. So we'll move on now to the county administrator's report. The first resolution is modifying the 2020 budget for the county administrator's office for costs associated with the court-ordered services at New York State operated inpatient mental hygiene facilities. Moved by Mr. Forsythe, seconded by. Is there a second to this resolution? Mr. Sheridan? Okay. Mrs. Doyle.
So the reason that you're seeing this resolution come through is an administrative change that happened in the budget process this year that changed the language in mental hygiene law 43.03, which changed the structure with which we're responsible for the costs of 730 exams and restoration. So in the years 2016 through 19, we received a total cost over those years with zero in 2017 and 18 of $188,718. So in this scenario, we've gone from having to be responsible for 50-50 split, 50% share to 100%. So in those years, if you doubled the amount, we would have been responsible over a 4-year span for $377,000. In 2020, we've already paid $118,000. We have bills waiting for this resolution to be adopted in the amount of $149,000 for a total of $267,925.49. And that's only through May. So there are 2 individuals currently being taken care of this way, and we do not anticipate a change in their status at this time. So I may, in fact, dependent upon their care, be back to you before the end of the year requesting additional funds. So the $500,000, you may inquire, has to come from contingency. So I can give you an update based upon those numbers, which we are fortunate this year. Out of the total of $5.4 million set aside in contingency for targeted reasons, with the exception of $700,000 set aside in untargeted, we have spent $143,522 to date. That will increase by approximately $700,000 when we fully implement the contract associated with CSEA. So at this time, my request is for $500,000 to hopefully make it through the rest of the year.
Mr. Lightfoot.
Ruth, you referred to this as an administrative change. Would it be more accurate to describe it exactly as it is, as another unfunded mandate?
You could.
I would. Thank you.
This was an area that we discussed in preparations for the legislative agenda this year. It wasn't one of the final items that were added, as we made an effort to reduce the number of items that we brought forward to our state elected representatives, but it's certainly something that when we see the totals at the end of 2020, we'll be able to have some data to support the unfunded mandate.
Mr. Lightfoot, did you want to include that language somewhere in this resolution?
That was a comment that I made. I didn't need to, it's in the record.
Okay.
It's out there. I don't regret it. I think that's exactly what it is. It's just piling it on.
Okay, thank you. Any further discussion concerning the resolution? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed?
No.
Motion carried.
So the next item under County Administrator's report is an informational item that I brought to you last month. And Legislator Reagan wisely asked for our planning staff to take a look at the proposal for alternative boundaries for a marine sanctuary that currently is under the process of being approved in Ontario. Jason Bohauer has joined us by Zoom technology, and you had an information item as well as a document included in your agenda. I just want to mention also, Jason will be speaking to additional documentation that will make available to you that was received with some disadvantages to the potential marine sanctuary. Jason?
Thank you very much, Ruth. Good evening, all. I won't completely go over the handout that you have in your packet, but I'll try to hit the highlights of this marine sanctuary proposal that is out there for Lake Ontario. It's pretty exciting. It's an interesting opportunity. As Ruth mentioned, I've been able to dig into it over the last couple of weeks. I've had some staff here do a little background research as well. And it's really I think an interesting opportunity that is presented to us here. So I'll just summarize sort of quickly what's on the handout. So NOAA is the federal agency which is involved with these marine sanctuaries. NOAA stands for National Oceanic and Atmospheric Administration, and they have about 13 marine sanctuaries around the United States at present. There are 2 additional proposed sanctuaries, one in the state of Wisconsin on Lake Michigan, and one in Lake Ontario. Simply put, a marine sanctuary is an underwater park or preserve where like local or local biosphere and underwater environments are preserved and somewhat protected. The intent of the marine sanctuaries is basically to protect the most iconic or most important natural cultural marine resources around the country. There are several, I think 4 or 5 on the East Coast, a few more on the West Coast, and there's some around the Hawaiian Islands and in the South Pacific. So what's happening in Ontario, or Lake Ontario, is a proposal for a marine sanctuary that's going to highlight the shipwrecks that have been that are there now. Some have been found, some are only known about. They have not actually been located as of yet, but they do know that they're somewhere in the Lake Ontario, the bottom of Lake Ontario. And so NOAA is proposing a 1,700 acre square, 1,700 square mile sanctuary that will run sort of running west to east from Cayuga, Wayne, or I guess the other way around, Wayne, Cayuga, Oswego, Jefferson, and potentially into St. Lawrence County. The map that's included in the handout that's on the next page doesn't actually show the St. Lawrence River, but there are portions of the St. Lawrence River that are included as well. And what is being proposed now is the addition of the St. Lawrence River that are in the town of Hammond. There are two shipwrecks, the America and the, I always want to mix this name up, the Keystorm, that are located in the waterway in the St. Lawrence River off of the shores of the town of Hammond, that have caught the eye of NOAA and the other proponents of this initiative, and they do want to include that portion of St. Lawrence County. So we did a little background on pros and cons here, and just identifying some of the pros. This is a national recognition and not a very, it's a pretty select group of marine sanctuaries. There are 600,000 square miles of ocean and Great Lakes that are identified, but there are only about, as I mentioned, 13 areas that are designated as sanctuaries. So it's national recognition, potentially for a portion of St. Lawrence County. There would be attention brought to the nautical history, the shipwrecks that are identified in the St. Lawrence River, in our part of the St. Lawrence River. There's some infrastructure that may be included as well. There is potential for installation of mooring buoys at the two shipwrecks in St. Lawrence County, and this would be a cost that would be borne by the federal government, by NOAA. And despite many requests to try to dig deeper on what are the restrictions that may come with something like this, from my research, there are no restrictions to fishing, recreational and commercial navigation. The seaway certainly would not be affected, or any other current river use as identified by NOAA. So, you know, it sort of sounds too good to be true, right? All good stuff, no bad stuff. So we did do a little more research on what might be potential cons here. One that we came up with was, you know, there could be potential increased boat activity, not necessarily a bad thing, but that could be considered problematic in some circles. But then there was some correspondence that was submitted to the county administrator, to Ruth. She received that last week, and it was from an individual that had compiled a number of questions and concerns associated with a marine sanctuary that is in the state of Wisconsin, in Lake Michigan. It's north of the city of Milwaukee and encompasses about 900 to 1,000 square miles. It's not officially sanctioned yet as a marine sanctuary, excuse me, but it's very long in the process. It has just last month, it was the final environmental impact statement was approved and is available. So there were a little ahead of myself regarding the concerns. There were some concerns that were identified by some individuals with this proposed project in Wisconsin. There were concerns about loss of state sovereignty over water bodies and what's in the water. Some loss of shoreline control, concerns about loss of shoreline.
Chair, Tony's just logging out, get dropped for a minute.
So Jason, you're froze up, so I don't know what you got going on there, but you're still froze. You look pretty handsome though, I can tell. Mr. Arquette.
Thanks, Kevin. Just an FYI, I was just taken off, went back to my email, signed back in, and it did let me come back aboard. We had our lights dimmed here in the Helena area.
Okay. Okay.
Thanks.
So while we wait for Jason to rejoin if he can, he did some research on the information associated with the argument for not having a marine sanctuary. You can join us live and speak to that. But what our next steps would be, if the board is interested in additional information, would be to have Ellen Brody come, as well as Phil Church, which is my counterpart from Oswego County, to come and speak to the board via Zoom technology as well, to give you a little bit more project specific. So this is kind of the global view of what range sanctuaries are and what the interest is in adding alternate boundaries to include the America and the Keystone. So if that's something that the board is interested in, we can certainly make arrangements for that in August or September. But we can, all the information both in your agenda and the arguments that were received not supporting the marine sanctuary are all in Google Drive under the NOAA Marine Sanctuary. So you can take a look at that, and perhaps next week at the board meeting, should there be more questions, Jason can join us, and we can make a determination if we'd like to invite those folks to our meeting.
Mr. Reagan.
Thanks, Ruth, and it's too bad Jason's not on. I'd like to thank him as well for looking into this.
Yes.
And I would like Ruth, just speaking individually, not, for the board, I don't know what the board's decision is going to be on this. However, I think it's a great opportunity for St. Lawrence County. And I would urge you to urge Mr. Church and the group he represents to take a wider look at some of the other shipwrecks here in St. Lawrence County. I think, the great majority of people in St. Lawrence County don't realize that the shipping industry did not start with the Seaway. It goes back, 300 years through the French and Indian War, the Revolutionary War, the War of 1812, and commercial shipping for the 250 years after that. And it was not, since the river was the major on a regular basis throughout St. Lawrence County's history, in which residents of the county were involved or that occurred off the shores of many of our communities. There are shipwrecks off the shore of Ogdensburg that I would like this committee to take a look at, and I'm sure that there are others over in the Messina area and others, and I think they should be encouraged to look beyond just Hammond and include the rest of St. Lawrence County, because it is one of the most little known part of St. Lawrence County's rich and varied history, and it can provide us with a great opportunity to make people across the nation aware that St. Lawrence County is here. So Jason, you missed it. I was thanking you for your efforts to look into this, and I was telling Ruth we'd like this committee, Mr. Church's committee, to look at expanding beyond Hammond into the rest of the county, because there are numerous other shipwrecks, and I see this as a great opportunity for us to have them spend money making people aware that they exist.
And that was one of my very first questions, anticipating that we have districts up and down the river represented. And it came back to, as an alternate boundary, these two to begin with. And it came back to one of the things we always end up with, funding and staffing. And so certainly something we will advocate for. I think that being a river rat myself, I'm very interested in getting this information out there and potentially incorporating it into the education system in St. Lawrence County. I think it is something also that is very underutilized as far as that goes with history. But Jason, did you want to wrap up the?
Sure, if I could, you want me to stand?
They can, yeah, everybody, if you're still right here in the corner,
okay.
I think the people that are zooming in can see you.
Hi, sorry about the connectivity issue there. I did try to log back on. I'm not sure what happened. We've had a lot of great success with Zoom, but anyway, I'm not sure exactly when I dropped out, so.
You're like this.
I was like,
just
talking about the cons.
The cons, yeah, right.
Oh, yeah, I mentioned, I think, maybe you heard me say, boy, it sounds too good to be true, right? All these positives. What is is there another side to the story here? And so there was some correspondence that Ruth received last week from an individual that was involved with the Wisconsin project. And there were some concerns, some allegations raised about the loss of state sovereignty, the potential loss of shoreline control for residents that might be proximate to the site, and also or some commitments for local financial contributions. And so I did reach out to our contact, whose name is Ellen Brody with NOAA, and she and I and another individual, her colleague in Wisconsin, were on a call today just to try to address some of those concerns. And I think for the most part, really they are unfounded from what I've determined. There's very clear language in the NOAA correspondence and everything that I've been able to find that there is no loss of state sovereignty, that the state retains the ownership of everything on the bottom of the lake, and they are accessible. Shoreline control, a concern. The boundary of the marine sanctuary will only go to the low water, they call it the low water datum, which is basically an average of the low water location on the shoreline. So there wouldn't be any, there wouldn't be anything on the shore that leads to riparian, what kind of riparian rights could be infringed. Again, it's clear that there wouldn't be any riparian concerns. And then what about local financial commitments? Who's actually going to pay for this? And the comment was made that that the federal government is responsible for marine sanctuaries. They have an allotment or an apportionment from Congress to pay for these. They have it's formula driven. So depending on what the sanctuary is looking at doing, it will determine how much money will go to these sanctuaries. So there's always an opportunity for additional input, for additional partnerships to be struck that could require funding. So they may come in the future to this body to say, we want to do this, we want to do that, we want to do a museum or something, we want to increase the impact of the sanctuary. But that would certainly be a decision that would be made by this body, and it wouldn't be a directive from the state or from the marine sanctuary entity. So I think that's it with regard to addressing the concerns that were in that literature. I think as a proposal, and I'm not sure if you talked about this before I came in terms of having Ellen from NOAA, as well as Phil Church from the Oswego County Administrator's Office, the Oswego County Administrator, who is an advocate of this and has been involved for some time on this, presenting to the board if there was the need for additional information. They could comment to a future meeting, possibly next Finance Committee meeting, but that's the pleasure of the board.
Any questions for Jason concerning Mr. Sheridan?
Yes, has the Hammond Town Board been presented with this information, the idea of sanctuary along their shoreline?
I have not spoken with them directly. I am going to be in front of them next month, and was going to bring it up at that time.
You could send them something earlier.
Absolutely.
Possibly just talking about the information I have here now.
Sure.
They'll have probably a lot of questions.
Yep.
Happy to do that. The sanctuary will, as you know, the St. Lawrence River is half of the rivers, Canada, and the other half is the United States. So does this sanctuary extend over into the Canadian waters as well? Or
it does not.
Okay, so that's why they would probably not mention the Henry Darya, which is a ship that's down, probably on the Canadian side of the channel.
Right.
And Hamilton.
Right.
Okay.
The two ships, the Key Storm and the America, look like they're very close to the border on the map that I've seen, but I was assured that they are in American waters, and that, yes, there's a hard stop at the Canadian border, or the international border.
Mr. Forsythe.
Yeah, Jason, do you know when the first one arose? When did they start these? You said there's 13 of them?
1972.
1900?
1972 was the first marine sanctuary. That's when, yeah. Yep, for the Marine Sanctuaries Act, National Marine Sanctuaries Act, I believe, was initiated the genesis of these.
Leery, just one side when you have a sanctuary, just for some reason.
Right, that's the terminology.
I just want to make sure we look at it closely.
Any other questions from the legislators? Okay. Mike? Go ahead, Mr. Chairman.
Just one more question. From what little you know at this point on maybe the shoreline rules and regulations and restrictions, does it appear that possibly, because it does affect the shoreline and just where the high water line is and all that, will that affect the building or construction of docks?
No, there is, that was another question that was posed. What about things that protrude into the water from the shoreline?
Yeah.
And there's no interest in having that type of regulatory control, because there isn't a mechanism to control that. Or the desire, there would be additional expense if they wanted to limit that, or to have some control over that, and that's not in their purview.
Okay. Is that it, Mr. Sheridan?
This decision will be made, do you think, of what time will what time frame, what were we talking about?
Thank you. Yeah, good follow-up point. The intent is to prepare the draft environmental impact statement, which is sort of the beginning of the real process in the fall and winter, 2020 fall, 2021 winter. And so having a border or a boundary by that time is what the desire of the group is. So that's, I guess that's the reason why we're before you now to get a decision here to move forward or not, so they can proceed with their.
The ultimate decision, if I can ask another question.
Sure.
The ultimate decision will not really be conducive to what maybe the township payment wants. Could that possibly could be, I mean, the federal government makes the final decision, kind of like with the 2014 plan?
Yes, that is possible that the town of Hammond may have some reservations. I think that again in the discussion with the representatives, granted they are advocates because it's their program. Their goal is really to work with the municipalities, the local municipalities, as much as possible to get buy-in at the local level, to not to ram anything down anyone's throat, but to make sure that they're comfortable, that they know exactly what they're getting into, what the future may bring, what kind of costs or anything might be associated with this. So yeah, I can't speak specifically to that, not knowing what that Hammond would want.
But it does raise the question, like recently you had one of those shipwrecks roll up onto the shore. I think it was in the Watertown paper. I want to say it was probably a couple of months ago, maybe it was even, and actually there was some family history. And so people actually, it was like the bones of the boat. And so actually people were cannibalizing the boat. And I think there was one family that had relatives that went down in that boat or a different ship. And they wanted to stop people from doing that.
Sure.
So what happens if you have a nice home on the lake and this ship, through the forces of the waves and stuff, brings this thing up from the bottom, puts it on your shoreline. All of a sudden, you have a sanctuary where you're not allowed to do anything, and so I mean, it's private property
Most of
issues.
those questions.
Yeah.
Certainly.
Yeah,
And I'm sure Ellen and Phil and their group would speak to the town of Hammond as well. to educate and answer any questions. Maybe not alleviate concerns, but at least have a dialogue.
Because I thought that's what stimulated this, because this information came to us the first time about a week. First time we talked about it came about a week or two after the article in the Watertown paper. So nobody's getting the Watertown paper that saw it then. But it was some families whose relatives went down on that ship.
Yeah, that's a
And
concern, for sure.
the bones of the, I don't know my boat terminology, I'm no landlubber, but, were left on shore.
Right.
And, so people were actually, this family was actually looking for help to stopping people from taking, nails or whatever,
Yeah. I understand.
specimens or something, remnants.
Well, on the surface, sounds like a great idea.
Right.
Find out what the cons are, more about the cons later on, but I think Jim's right. It's landlocked river from what I understand so far. I don't think it's be harmful, but we'll have to check and see what the details are.
So it seems like we'll invite these people to Zoom in at one of our meetings.
The information is on Google Drive. Perhaps take a look at it this week. It has both sides of the argument, and then maybe at the board meeting, we can make a determination if we want to invite them.
Okay.
Okay, thank you, Jason.
Okay, thank you. Sorry about the technology.
Snafu there.
Thank you for coming over.
Oh, no problem.
Okay, so Ruth, you're gonna talk about the second quarter financial update.
Yes, so in your packets, you have the summary update, and for a few of you, this is the first one that you've seen. And the first item is a 2-page document that really captures looking at it from a budget perspective. So the board adopts the budget, and what we wanted to do was take a measure, and while resolutions come before the board every month at every committee to modify that budget, we wanted to keep in perspective what the adopted county costs looked like to what was remaining of the budget. And so in these totals, we also provide the percentages out to the far right. You have half of county departments that are above that magical 50%. And as you might imagine, most of them, 6 of them happen to be between 50 and 60. So I think that's, pretty easily explained. And then you've got another 6 that are beyond that 60%. Now, we have the anomalies like the treasurer's office. We've got a few, in this case, planning is one. But the departments that are remarkably different, if you look into the next document, which I'll walk through in a minute, you can identify pretty quickly where those differences lie. And that is, in most of these cases, due to revenue. And what I've done also is looked at the 2019, where we were in more normal conceptual times, to this year's report. So overall, if you look just at that bottom, this is a Fund 1 capture of all the departments. Page 2 captures the other funds. In 2019, when you look at the total appropriations, we're at 44.98%. Last year at this time, we were at 43.56. So relatively close. For revenue, even closer. Last year, at the end of the second quarter, we were at 77.77. So again, we're pretty well spot on to last year. As I mentioned, that second page captures the other funds, the 2 highway funds, solid waste, and the county attorney workers' comp and liability and casualty. As well as, for the last approximately year, we've been providing you with an overall capital project expense. That's more easily identified if you look at the second document in your packets, which at the top gives you a combined, all of county government combined, compared to 2019 for salaries. This year we're at 44.87, top of that second set of documents. Last year we were at 45.01. And on down through, we are not far apart. The biggest change for 2020 is an increase in fringe benefits at 44.57. Last year at this time we were at 37.97. So we're seeing an increase in our health insurance costs this year. Our total appropriations though between all funds is 42.12, you see there. Last year at this time, we were at 41.51, almost identical. The big question is revenue. This year, we're at 52.28%, all funds combined. Last year at this time, we were at 55.23. So while we've had many conversations, spent many hours, and we will continue to as we prepare the budget as well as the projections, we ended the second quarter better off than I think any of us anticipated. That doesn't mean there's not challenges ahead, as we also anticipated we would know more at this point in time about the state budget reductions. Those we're watching for very closely. We've really only seen the CHIPS reduction, the reductions associated with OMH and OASIS in our community services department. So real briefly, I wanted to highlight just a couple of areas for you. Some of the areas that generally, if I don't tell you, you will ask. Community services, if you look at their revenue, which has been great discussion and consternation over the years. This year, if you look at the 500s net revenue line, we're at 49%. Last year, we were at 39.22%, a 10% increase in 1 year. I spoke to you a little bit when you see the county administrator's budget under contractual, that amount at 17%. I spoke to you a little bit about the contingency account and where we lie at this point in time. Flipping over next, the next question I usually get is with regard to the DMV downstate revenue. That's on page 2 of 8. And if you look at the revenue in that line, while it's all combined for all the satellite locations, as well as the downstate, you're seeing that number reported as 27.99%. Last year at this time, we were at 38.82%. And we've been talking to you all along about a 10% reduction due to the shutdown that we're dealing with right now. Certainly, as many of you know, they're very busy. I mentioned in an email to all of you that they are now allowing online appointments for Canton. We've added 3 phone lines to the DMV, just to speak for a moment to something that I'm sure occupies some of your time, as well as the Dropbox locations continue to be full and processed by our talented staff. So when you continue looking through, some areas will jump out, mostly associated with revenue. I would point out emergency services. As you know, they're very grant influenced as far as their revenue goes. Last year at this time, their revenue was at 5% received. This year it's at 14.7. And on down through, if there's any specific questions, I'm certainly happy to address them in planning. Again, another department that's heavily influenced by revenue received. Last year at this time, where they're at 6.27% in revenue, they were at 15.86. And that's heavily reliant on the types of grants and the types of reporting they've been able to do. Departments that are heavily influenced by state aid include probation. They're at 41.16. Last year at this time, they were at 48.66. So not too far off from what we were expecting. Public health, on the other hand, last year at this time, they were at 25%. This year at this time, they're at 14.45%. But overall, their reporting and their reconciliation that they're working with the state is in line with where it should be. Flipping over to page 5, for the sheriff's revenue, last year at this time they were at 28.94%, not far off again from the 26 they're reporting this year. One question that typically comes up when we talk about the sheriff's office is overtime. And at this point, overall, all departments considered that have budgeted overtime, $797,000, that does not include the set aside and contingency. We've spent $460,000 to date. And we're working very hard to capture all of the funds associated with COVID. For example, public health is nearing $25,000 in overtime. That will all be requested under FEMA reimbursement. The jail currently is at $72,000, which is low for this time of year. And the roadside is at $77,000. So they will be coming to you probably the fall and asking for the remainder of the contingency amount. County clerk is at $24,000 in overtime. Highway is at $61,000. And social services is also at $50,000. So set aside in contingency is an additional $187,000. And that form is updated on Google Drive and it lists out each department and what's available for their funds. Revenue under the treasurer, just going back to page 5 briefly. That is where sales tax, occupancy tax, tribal state revenue, all of those are captured. Last year at this time, the 4th line up from the bottom, we were at 66.34%. This year we're at 67.31. We know we're lagging on occupancy tax, and we also know we've not received any tribal state compact revenue. But as you all saw last month, the sales tax is catching up. So on down through, certainly some of you are more familiar with others, some areas than others. If you have any questions, I'm certainly happy to answer them. Just one point, considering all the reduction in travel that we've faced the last few months as a result of COVID-19 and the response associated with it. For the fuel island, just as an example, in 2019, we were averaging 43,000 per month. This year, so far, 33,000. This point last year, we spent 260,000. Currently, we're at 198. So we are seeing some reductions in spending associated with travel and things of that nature, but we also will continue to see reductions in revenue. We'll keep you posted monthly, and certainly I can answer any questions associated with the report.
Any questions for Mrs. Doyle? Mr. Burke?
A question not associated with the report, Ruth, and you may not know it offhand, but I'm wondering where our fund balance stands at the present time.
I can share that with you, John. I think it remains unchanged until the audit is complete, but I'll get you the most recent numbers.
Okay, thank you.
Sure. There's no other questions? We can go on to the resolution.
Okay. So our next resolution is amending resolution number 197-2013, extending the authorization of St. Lawrence County to impose an additional 1% of sales and compensating use taxes. Moved by Mr. Lightfoot, second by Ms. Curran. Discussion.
So this resolution, some of you may recall seeing in 2013, which it's amending, and 2015, when the resolution and process associated with the increase of the 1% had to be approved and a very formal process undertaken. However, in 2017, the last time that the extension was provided, we were not responsible as it occurred in the budget process, as it occurred this year in the 2020-21 budget process. However, last month, County Attorney received communication from Department of Taxation and Finance requesting that a similar process, not identical, a similar process, which turned into the resolution before you, where the county board authorizes that increase. It's already been provided for by the state, so we didn't have to do enacting or requesting enactment of legislative bills. That's all done. What they wanted was us to pass this resolution or to request consideration of this resolution so that we can stay on schedule for the December 1st date in 2020.
Any questions for Mrs. Doyle? Seeing none, all those, I'm sorry, Mr. Reagan?
Yeah, Ruth, what impact is this going to have on the city of Ogdensburg?
In this situation, this will have the same impact on Ogdensburg it has on the county and all the towns and the villages. This will allow the 1% to continue to be collected for the next 3 years.
And in terms of the arrangement for, the current arrangement for sharing the sales tax?
That arrangement remains in negotiations. This agreement, and I can have the county attorney speak up to it if you wouldn't mind, he spoke to Department of Taxation and Finance about the language associated with this.
As you'll notice right now, it's my understanding that we only have a tentative agreement with the city of Ogdensburg for the continuation of the distribution along our current rates for an additional year. What you see in front of you envisions that continued rate for a single year of collection for a 3-year period. If we reach an agreement with the city of Ogdensburg that would cover the periods post 2021, a new resolution would have to be passed at that time that would encapsulate what that agreement means for distribution to the city, the towns, and the county. But what you have in front of you accomplishes the continued distribution according to the 1-year extension that's been negotiated.
Now, it's my understanding that the city approached the county about an extension beyond the 1 year. Is that correct?
That I don't know, I wasn't a party to that.
So we could, Mr. Lightfoot had his hand up. Mr. Sheridan, your mic is still on. Mr. Lightfoot?
Thank you. I was approached by the mayor by phone several times. And what he wanted to do was to extend the deadline of, I believe it is September of this year to September of next year. I consulted with the county attorney. Make a long story short, it would grant them something additional. Maybe you can explain it better than I.
Certainly, this would not amount to an extension beyond the 1 year. They were looking, at least as it was relayed to me, was they were looking to expand the period of time in which they could exercise their exemption, greater than what a normal 1 year extension would have provided. But this would not have changed the 1 year collection period at all, just a longer period of time for them to opt out going forward. For example, under the prior agreement, the opt-out period had to be triggered by September of 2019. To extend it one specific year would have given them until September of 2020. They were asking for additional time on top of that to opt out, but not additional time for the distribution under the current formula. So the current formula was never, as I understood it, going to exceed at least the 1 year as has been relayed. And if you'll recall, we passed a resolution that adopted essentially an extension agreement that was reviewed by the Comptroller's Office, reviewed by the Department of Taxation and Finance. And that went to the city of Ogdensburg, but I don't know what the status of their resolution is at this point. I don't know that it has been passed.
Has there been any communication between the county and the State Department of Taxation on whether or not they're going to be able to, if the city preempts, and which is something that many people in this room have been pushing the city to do, is the state able, if it were to happen on the schedule that's being talked about, that the state will be able to actually make that split? You know,
I've had discussions with the Department of Taxation and Finance. I view your question as a question that should be bifurcated. The first question is, what if they have not passed the resolution to adopt an extension of 1 year right now? In which case, our current agreement ends November 30th of 2020. And they lapsed it. That is not technically a preemption. They just lapsed. We have no agreement. They haven't preempted. They're not collecting their own. And then it goes according to a formula that's on 1262 of tax law. If they do extend by 1 year, but trigger their preemption at a separate date later on down the road, my discussion with the Department of Taxation and Finance was with respect to that question. And my understanding was that they could accommodate that, assuming they were all in agreement that we're doing a 1 year extension of the timelines right now, that they would be able to accommodate a preemption at a later point in time. But right now, if we have no agreement and they haven't triggered the preemption, and November 30th comes along and no resolution is passed by the city of Ogdensburg, they lapse into the formula that is established by statute.
And the formula by statute is?
It's actually a rather convoluted formula. There's a percentage that goes towards county operation. There's a percentage that goes towards distribution to towns and villages. The county can actually designate under 1262 that it wants to utilize certain funds for county purposes or educational purposes and rededicate funds that are otherwise distributed to the city. Without getting too far into the advantages or disadvantages of that practice, it's my understanding right now that we have a tentative understanding to extend for a year. If that has not occurred or will not occur, this resolution, another resolution will ultimately likely have to come that would modify this resolution to a certain extent.
So, and I think that's contained in section 2.
Because it's an
on-
amendment.
Pardon me?
Because we're amending resolution from 2013.
So Mr. Forsyth had a question, and then Mr. Lightfoot.
Well, the other thing I just want to note is that they have a new city manager that's in place now. He's reached out to Ruth. Ruth contacted me about scheduling a meeting. We're going to try for early next week to sit down and take it back up, so.
Yeah, and, you know, and I just want to make sure that, we don't, create a situation where we're not able to accommodate, the city's needs as well as the county's needs, and, you know, especially since the city has gone through a lot of changes in terms of its administration, and there's a new city manager who is reaching out to Ruth and wants to work together. And I think that if we can find a way to work together amiably, that both sides have an opportunity to find new ways of improving services to all the people in the county.
Okay.
That's our
You had a follow-up?
common goals.
Right.
And this resolution, just as a point of information, needs to be filed prior to September 2nd. That is the reason you're seeing it now. It shouldn't preclude us from any arrangement with the city of Rochester.
Okay.
Thank you. So I just wanted to clarify those points because I'm sure a lot of people in Ogdensburg are going to be concerned about just what is occurring. And I'm particularly pleased, Mr. Chairman, that we are finally getting this out in the public so that we can be a lot more transparent about what's going on. Thank you.
Okay, thank you. So, Mr. Smithers.
I just want to make sure that I'm hearing this right. Are you saying that these percentages in section 2 of the allocations to the towns are the same as they have been in the past?
That's correct.
Okay, so all those in favor of the resolution signify by saying aye.
Aye.
Opposed, motion carried. Thank you. Our next resolution is authorizing the chair to sign a lease agreement with Patty Farley Spillman for space in the Village of Governor at 99 West Main Street. Moved by Ms. Curran, seconded by Mr. Forsyth and Mr. Lightfoot.
So this resolution comes before you in an effort, as we're working with all of our landlords throughout the county, we have 3, to put lease agreements into place. We have been in each scenario, which includes Messina, Ogdensburg, and Governor, been working on month-to-month agreements. So there is in Governor some work to be completed, and the rate as presented to you, I believe is reasonable on both sides and will allow some of that work to be completed. Currently, the probation department and community services are located there. As indicated, when public health closed their home health agency, they returned staff to Canton, and this particular landlord was exemplary to work with, who actually found another tenant at that time, so that the burden wasn't shouldered by the county. So in this scenario, we're working to maximize use of the space there, potentially looking at some flex space that if there were a reason for a staff member to be in that area, they may be able to work at that location as well. But we did want to put lease agreements in place, and you'll be seeing those over the next couple of months. Questions?
Okay. Okay, seeing none, all those in favor of the resolution signify by saying aye.
Aye.
Opposed, motion carried.
And lastly, just a couple of items if I could, Mr. Chair, report
Sir,
on.
yeah,
With regard to COVID-19, just to get you up to date, after the weekend, we are up to 540 complaints associated with the New York pause. Our new website has also, because of the web form availability, been in receipt of some complaints by the public, so we're responding to those as well. And we, at this point in time, continue with the education and awareness approach that we've been taking. We are not seeing as many of the large box stores, if you will, in the complaints. We are seeing more of the single location businesses, and so we are taking the opportunity after we received more than one complaint to communicate with those businesses. And we have received compliance and seen many of the modifications associated with that. I did want to mention to you the interest that I have in extending. You were kind enough to pass a resolution allowing employees in resolution 152, 2020, to utilize the opportunity if they've been working in the office to buy back a week's worth of vacation. I am getting the totals for you now, but I would like to extend that by 30 days to the end of this month and provide that to staff. It indicates in the resolution that provided I bring you the report and there's no objection, we can extend that benefit. So I'll bring you the total to the board meeting of the total individuals as well as the costs associated with that. The reopening efforts that I had mentioned to you, we are complete with all of our modifications at this time. The schools now are beginning to compete for plexiglass and the other types of modifications that we've just completed. And we, if you recall, were also in a queue with back orders associated with those types of materials. So I'm glad we're done with those. And we're finalizing the efforts, and I would like to share with all of you the self-assessment tool that we'll be doing. We're using a survey tool that we have already, which is SurveyMonkey, to provide our staff with an opportunity to do a daily survey, like we're seeing courts do, businesses do. So I'd like to share that in draft form with you. We're working with HR to make sure that the questions that we're providing answers to can be collected then by the supervisors, and that tool can become what's most likely going to be a bit part of business going forward. So that is one of the last pieces that we're working on as we try department by department, whether they're taking appointments or they're receiving phone calls to welcome the public and making determinations. Seeing the uptick in numbers, that's a bit of a bigger challenge for us, but we're working to accommodate the public as best that we can. I did want to mention, just to follow up on Dana's earlier remarks, we had talked in the reopening task force about the public health I wear a mask to protect campaign. They're moving forward with the contest that they held, and I'm working with Alexa Backus in the Youth Bureau to try and approach the school children. We had talked about some type of a K-12 type of contest for signage as well, and potentially to design a mask. So we're working on, and I'll bring you some more information, to encourage the school population who are also going to be tasked to be wearing a mask during school hours likely, but how they approach that and if we can be helpful, we'll bring some information back to you. The real property correction of errors are located on Google Drive for you to review. I wanted to mention to you that the Youth Advisory Board, I think as Legislator Terminelli pointed out, has updated their bylaws. They'll be bringing that to you in August for approval, much like you just approved emergency services updates to their bylaws as well. And finally, the work is being completed on the 2020 foreclosure auction. This year, our numbers are significantly lower than our 5-year average. For 2018, we have 124 parcels prior to the public accessing the rights back to those, instead of our average, which is the 314. And we'd like to provide you with an additional update on that shortly. Unless there's any questions, that's all I have.
Done. Mr. Forsythe.
I just had one question back to the New York laws, the 540 complaints.
Yes, sir.
In a weekend, how many do we get on average?
Over this weekend, we received 28.
28? So that's gotta be down.
That is down from, we would get as many, I believe our high was 40 in a day.
And most of the complaints are towards businesses?
We're seeing a mix of mask wearing for both folks entering businesses as well as employees, those kinds of things.
How about mask gap?
Mask gap, we are seeing social distancing. We're getting some information prior to events, which is a challenge for us. But we're trying to respond to those as well by, again, increasing education and awareness about what's allowed at this point under the executive orders.
Okay, and no businesses have been non-compliant that you're aware of?
We have received reports following our communication, so I'm not sure how to answer that question, whether they are at the time or not. Often what's happening is we'll get a complaint. If we were to send someone out, the event's already occurred, or the patron's already gone. It's a very interesting dynamic to try to respond when we need to. But our hope is, and most have been very compliant when they're approached.
Okay. Thank you for those 2 items that you mentioned. So we'll move on to committee reports. Cornell Cooperative Extension, Mr. Denisha.
Mr. Chairman, our next meeting is actually tomorrow evening, at 5:30, and we're planning on meeting at the farm.
No.
But we're also going to offer the if anyone wants to zoom in, they can do that. We're going to have another USDA food box distribution, actually 2 more. There's going to be one Thursday, July 30th, here in Canton. It's at the Sandwich University Parking Lot J from 9 a.m. to 12 noon. 3 boxes, meat, produce, and dairy. And then on Thursday, August 6th, we one at the Governor Community Center from 9 to noon. And there'll be 400. It's all in coordination with the Cooperative Extension, Church and Community, Garden Share, FTA, Government Food Bank. So a lot of moving parts, a lot of people that are doing a lot. And we're beginning the 2021 budget process.
Yeah. Thank you, Mr. Denisha. For the Fish and Wildlife Management Board, Ms. Curran.
We have not had another meeting. We don't have a schedule.
Okay, thank you. Fisheries Advisory Board, Ms. Terminelli.
No meeting and no update.
Okay, so we do not have a Governor Fair Board representative at this time, but that typically goes to the Governor legislator, which would be Mr. Smithers, but that would be up to the chairman. But as I think there is not going to be a fair this year, is that correct?
I believe that's correct.
Okay, thank you. So the Highway and Solid Waste Committee, Mr. Denisha.
I have nothing to report.
Thank you. Mr. Reagan, the IDA, Industrial Development Agency.
Mr. The IDA has not met this month. It has been very active with the reopening committee and working with public health and with the Chamber of Commerce to help educate businesses and develop ways to keep our businesses open by following the 5 pillars that were outlined earlier. I do want to say that I'm pleased we have 2 outstanding people who are up for reappointment to the IDA board, Ernie LaBath and Brian Staples. Brian is currently the chairman of the IDA and does a tremendous job, donates thousands of hours to the county. And Mr. Ernie LaBath is the vice chair, and he also brings 40 years of experience and has been a terrific member of the IDA. And this is 2 people who have worked together very closely from both sides of the aisle and are examples of the kind of people we need working in county government and setting an example for how both sides can work together. Thank you.
Thank you. Yes, I do hear the IDA commercials quite often. Recreational and Trails Advisory Board, Mr. Arquette.
Thanks, Kevin. We've had some successes in and around the town of Clare recently on some local laws, and but the group, the Trails Advisory Board, has not met since our last meeting. Thank you.
Thank you, Mr. Arquette. The St. Lawrence River Valley RVRDA, Mr. Forsyth.
The only thing going on right now is the community development grant applications.
Right.
They're being reviewed and they have a matrix for scoring.
Yep.
Then at the next month, we'll start allotting and rewarding.
Okay, thank you, Mr. Forsyth. St. Lawrence County Chamber of Commerce, Mrs. Haggard.
Thank you, Mr. Chairman. We haven't had a regular meeting, but we're on their website tomorrow morning at 8:30. There's going to be a virtual call-in with the colleges on their reopening plans. And if people wanted to attend that virtually by computer or phone, they should go to the St. Lawrence County Chamber of Commerce website, and it describes how to join that meeting, and it's going to be Clarkson, St. Lawrence, SUNY Canton, and SUNY Potsdam participating. So if people have an interest in what the colleges are planning, that'd be a good time to find out about it. Thank you.
Thank you, Mrs. Haggard. Soil and Water Conservation District, Mr. Berg.
Ryan Cunningham from the state committee presented early in the meeting, and there isn't a lot of news. He basically said ag and markets are largely on pause. The climate resilient farming is on pause. State aid unknown at this time. Our local office is pushing forward with contracts and payments. They did a budget summary, and the income from the state and county have been stable. The office is being staffed with 2 people. The whole building, which houses other agencies, can only have a limit of 10. So soil and water's quota is 2, and we have 2 staff there every day. They estimate, we met all the funding requirements for the Part C funding, and they're looking to replace one of their vehicles next year, the F-150. And they're also proposing to fund one of our county highway department's culverts. It's a sizable replacement. So again, a great partnership with Soil and Water.
Thank you, Mr. Berg. Okay, so that concludes our committee reports for old and new business. We have a resolution adopting local law A number, there's no number provided, for the year 2020, selecting salaries for county employees. Moved by Ms. Curran, seconded by Mr. Dinesha. Discussion. Mrs. Haggard.
I looked this over. I did not see anything affecting general counsel for DSS, so I'm going to assume that I would be able to vote on this. Is that correct?
I would refer to Mr. Button. The only position would be the Commissioner of Social Services. There isn't a salary listed. Can Mrs. Haggard vote on this resolution, or would she have to abstain?
Actually, this is establishing the salaries of the officers of the organization. The Office of General Counsel is not an officer of the county. So while it does have the commissioner's name listed there, as indicated, no salary is established there. So I think Mrs. Haggard would be more than all right to vote on this issue.
Thank you.
Welcome your vote.
Thank you.
Okay. Any? Yes.
I just wanted to mention that Legislator Arpit lost power, so that's why he's not continuing to be present. Okay,
so must be a storm going on in Helena. So we'll note Mr. Arquette's absent because of power allotment. So any more discussion on this resolution? Seeing none, all those in favor of the resolution signify by saying aye.
Aye.
Opposed, motion carried. Good, thank you. All right, so next up, we have an opioid treatment program update concerning the methadone clinic. Do we have Mary Jones with us?
You do?
Okay. Well, welcome, Mary. Are any other board members going to be able to, or because of the time constraints, they're not going to be able to?
Sherry Hewittson's here, Patty Hogle, and Heather Rand.
Okay. All right, so go ahead and give us your report.
Okay, so the board met on July 15th to discuss the 3 proposals that were submitted. Chris Weber, one of our board members, at Jay's request, put together a
scoring matrix of how we would score each of the applications with a total rating number of 100 points at the end. We also had invited Suzanne Levine, who is the Director of Community Services in Franklin County. She also temporarily served as the Community Services Director here in St. Lawrence County. She was there solely to provide any support and questions about OASIS and the OTP regulations. So we started off with Chris reviewing the matrix. It was sent out prior to the meeting along with the applications. And she went through it on how to use it. There were no questions about it. The board wanted to move forward looking at the applications. I then introduced Suzanne Levine and her role there at the meeting. She was there just to offer support and understanding of the OASIS OPT regulation. She was not there in a role of voting for a proposal. Suzanne asked the group if there was any questions about the regulations, and there were none. The first proposal we discussed was St. Joseph's. It was, I think the best way to describe it was disappointing. It seemed like it was very last minute. The process we went through and discussed all of them, and we discussed the strengths and weaknesses of the proposals, and that's what I'm going to share with you tonight. The strengths of St. Joseph is we felt that it was their experience. They had a strong evaluation process, and the location of the OTP would be in Messina. The weaknesses were overall, it was way too vague. It appeared to be a rushed application process as it did not provide a lot of details. There was no peers, there was no revenue projections, and it was really contingent on whether or not they got the $900,000 in the grant. So that we went through that relatively quickly as the board members didn't feel that there was a need to discuss it. The next one that we reviewed was the St. Lawrence County Health System, or the St. Lawrence Health Systems. Their strengths were the integration of care, assuming a loss in the first year. They had a full-time medical director included in their budget, and they had a very solid security plan. The weaknesses were the construction expenses were not justified, and we recognize the silo mentality of St. Lawrence Health System. I would say that this was the plan that people were most excited about. They really liked how they presented all the information. The last one we discussed was St. Lawrence County. The strengths were a very strong narrative, return on investment, the 2 full-time peer recovery, embedded services with an incarcerated population, and the community collaboration piece. And the weaknesses were identified as security, medical director limitations, and salaries. After we went through all of these, we then went to scoring all of them, and Chris did the calculations for the scoring, and it ended up that St. Lawrence Health System came out at the top. I did ask the board if we had 2 options to pursue. One was to ask the 2 top proposals to attend a Zoom meeting the following day, and option 2 was to vote on the selected proposal. And everyone wanted to vote to select the proposal. They were not interested in a conversation.
Okay. So, Ms. Hewison, would you like to add anything, or?
No, I think Mary did a nice summary of that. We clearly felt we moved on quickly from St. Joe's proposal. And there were a lot of good conversations about the pros and the cons. And we had a good number of people voting. So I think the matrix really helped us determine which way to go, and it was pretty clear.
Okay. Thank you, Sherry. So we'll open it up for questions. Does anyone have any questions concerning this presentation? Mr. Berg.
Actually, I have a number of questions, but I'll start out with the first one. So the decision was made based upon a review of written proposals, as I understand it.
Correct.
And there was no opportunity for any of the organizations to present, to elaborate, to answer, again, any questions people would have, or to embellish their proposals. Is that accurate, that there was no?
Yes, the board was given the choice of asking the two top candidates to come in or to vote on the proposal.
Another question I have, the people that were there, the people that were voting on this proposal, how many have a background in substance abuse?
I have no idea.
As I looked at it, as I looked at the people that were in attendance, I saw a possible one, and that person isn't working in substance abuse at this point in time. So, and again, you know, and I looked at the matrix. I looked at all three proposals, and I guess, you know, my analogy is, would we hire an executive based upon a resume without an interview? And there is so much more gained by having the entity there and people asking questions. And I looked at the scoring matrix, which was developed by somebody with a mental health background, not a substance abuse background. I looked at the scoring matrix, and it seemed to me that you were able to get 30 points for providing your agency's description. I saw little weight. There was a little bit, but very little given to location, and we know how critical location is when it comes to the citizens of St. Lawrence County and people needing substance abuse treatment. We know how critical location is, and the location for St. Lawrence Health System is the mall. And I see that they received, you know, according to your report, Mary, they received kudos for their security program. As I guess I would ask the question, has anybody been to the mall at 9 o'clock at night? The two security people that they're looking to hire, I'm assuming, are there during the daytime when the clinic is open. So again, as I look at this, I really struggle with it. And I struggle with the lack of opportunity. I struggle with the fact that the people making the decision don't have the background in substance abuse. I struggle with the scoring system. I struggle with the fact that St. Lawrence County residents are losing, St. Lawrence County residents are losing $1.4 million to a private entity, that 1.4 million would assure the continuation of the core services we now provide. And it's okay if it was done on a basis of merit. And I have to tell you, I've looked at all three proposals, and I'm not putting myself in the position of being the judge, but I certainly am critical of the process. And I just, you know, there are judgments that are based upon the budget. Who in your committee has a background in budgets? I mean, who is an expert in that area? Is the staffing sustainable? When you pay $300,000 to your medical director, is that a sustainable salary? You know, there was commendations given to Canton Potsdam Hospital for their salaries, you know, and keep in mind, this was nothing more than just a plan. So what is actually done, what they state on paper, and what they're actually able to do, and at what stage they're able to do it, is an unknown. And the one other thing I would say is well, again, the location is critical. Having a location in Messina proper, where there is the Messina police and the support structure and easy access for a number of people, I would think is a critical piece. And I saw very little merit given to that. And Jay, I saw your face on the screen just a minute ago. If I could ask Jay a question.
Sure, go ahead, John.
Jay, if you were given a chance to describe, if you were given a chance to provide a narrative for county services, what salient points would you have offered?
Well, I mean, I think, you know, we started looking into this process of opioid treatment program back in June of 2019. You know, kind of per the guidance of Oasis, who, you know, saw the gap between, you know, the two current North Country providers, those one being in Watertown and the other being in Plattsburgh, and that there was a huge gap there. You know, they also identified people that were traveling outside of the county for these very same services. So because there was that need, and then for subsequent investigation and, you know, looking at the data, you know, proved that that need was, you know, a real need for, you know, this area, not only for St. Lawrence County, but it would also be able to service people from the tribe as well as Franklin County. So, you know, that was, you know, one of Oasis considerations. And then they also felt it would be, you know, financially stabilizing to the St. Lawrence County Community Services clinics because of, you know, the history of most, if not all, of the OTPs running in the black. So it would offset some of the, you know, the other expenses that, we have in terms of, some of our, more difficult, types of overhead that we face running a county clinic. So based on that, we did, our due diligence, and, we went to Credo and we toured the facility. We got some information, in terms of actual reimbursement rates, information about security and safety, cost of medication, what their matrix was in terms of, the number of visits, whether they were individual, group, and dosing visits, and based on, their real-time data superimposed onto what we thought was the client base here within our area, came up with, a budget that was based on, for the most part, actuals. including the revenues, in which we also explained. We also got some technical assistance from New York State OASIS Addiction Medicine Advisor that helped us with floor plan, the flow of the traffic within the clinic. We also were in contact with Catholic Health Systems. We had some expert consultation from Dr. Paul Updike. As you know, he presented to the Board of Legislators, as did Credo, in terms of their insights of the need for an OTP and kind of the ins and outs of that particular specialized clinic. I think, with those things in mind, Shana Smith did the bulk of writing for the U.S. Department of Justice grant, along with the assistance of Heidi Ames from the planning department and myself. So we got that grant submitted. I think it was May 21st, I believe, was the due date for that. So we got that in. And then because there was $245,000 worth of SOAR money that could be used, towards a new AHR for, county clinics, along with some of the other startup costs, being a safe and the ballistic glass and some other construction materials, software and things like that for the pump. The SOAR monies was then, because there was some concern, from some of the legislators about, not, realizing that there, may be a need for this type of specialized treatment within the county, but some legislators, were not sure if they really felt that the county should undertake such a task right now. So that, along with the SOAR monies that were at stake and the potential grant monies that won't be announced until, I believe, October, it was recommended that we do an RFP, which again was drafted in the rough by Shana Smith and completed by myself, along with Mike Cunningham from Governmental Services. We got the RFP completed. So, currently at stake, potentially at stake, there's, $1.145 million that may be available. Certainly the $245,000 from SOAR, if approved by, the LGU and OASIS and OASIS's broker, the Research Foundation. If that gets approved, then that will also be available for this project.
Jay, could I ask you, who did OASIS approach to have this clinic?
Well, they approached the county clinic, county chemical dependency clinic staff, myself and Shana Smith.
And they could have asked any other entity, because they know all of the players in the county. They could have asked any other entity. Is that correct?
They could have, yes.
Yeah.
Okay, Mr. Arquette, you have a question? You got power back there? You got a big storm or what?
I did. We had a couple surges here, and it's not raining, but for some reason we lost it a couple of times. I apologize if I'm going to repeat something that may or may not have already been said. But I had two concerns in and around this the situation in community service. First and foremost, maybe, I don't know if Mike Cunningham's listening, but the procurement, I think as Jay just said, what I just heard Jay say was it was decided that if we go to an RFP, I was always my understanding that RFPs were either a necessity, via governmental law, or it seems like the Community Services Board they have the ability to decide whether something should go to RFP or not, is my first question.
So that would be correct.
They would have that ability to choose?
I don't know, Mary, would you like to answer that? The answer is that the Community Services Board this is in charge of basically seeing whatever needs there are in the community, whether it's drug addiction or mental or whatever, that those needs are met. So they act somewhat independently. If the Community Services Board determines that there is a need, say for example, the county board did not think that there was a need for the methadone clinic, I believe the Community Services Board would have the right to move ahead without them. The county still would have to sign some kind of agreement. Would that be not correct? With any monies that pass through the state to the Community Services Board. But the function of the Community Services Board would be to see that the needs of the population are being met, whether it's in all those areas, housing, mental health, drug addiction. So they have that independence to go ahead and ask for an RFP.
That's my understanding.
So again, I was under the belief any municipal monies that were involved would be needed to be procured through an RFP. So I got information for me. And then secondly, my concern was in and around the location that was decided upon. The fact that that area needs to be extremely protected due to the contents of things like medications and other things. Was that the best suited place? How did that get decided on where it would be?
It's what was in the proposals. Two of the proposals had Messina.
And the mall was what the group felt was the best facility.
Overall, we thought that that was the best. Yes. I think that there was a lot of challenges to this in that the deadline was quickly approaching. And I'm certainly not throwing anyone in the county under the bus. And I feel like the statement will, that we were, in my understanding, we had to make a decision very quickly. And, you know, for better or for worse, that's what the board did. Should we have done it differently? Probably. I'm not saying that we shouldn't have, but we were under the gun to get that completed.
Thank you, Mr. Chairman.
Mr. Perkins has a question.
Mr. Chairman, I agree with just about everything Mr. Burke said. One thing that really concerns me is the process that you did. To me, it seems like you're just taking a resume and accepting it without actually talking to somebody. There's no follow through. I think there should be, you really should have dug deeper in that. I mean, I could throw something in there and you don't know if it's right or not. I have concerns with maybe a couple of these places, but you know, I think you should have done your due diligence, done the Zoom, done the follow-up questions, done some research, even though you were under the gun. You know, I think you hurried it through and didn't do your due diligence. That's my opinion.
No.
Thank you.
Mrs. Haggard.
I agree with Mr. Perkins. It doesn't seem like the depth of information could be given on paper or whatever the presentation was. So I just want to back Rick up.
Ms. Terminelli.
I'm concerned just that maybe the history of the two applicants wasn't considered because it did seem to be focused on the application specifically against the scoring matrix. And so I'm just concerned in the past month alone, in the month of July, St. Lawrence Health System has, at the beginning of the month, they announced an elimination of 26 furloughed employees. And just this morning, another 46 that they announced. This month, they've also ended after-hour surgery at their Messina hospital, as well as closing the maternity ward. The mid-month, they signed an affiliation with Rochester Regional Health. I'm wondering if these are a lot of changes for them to be considered stable to move forward with a new project of this caliber. And then I would also, I'm curious as to, I'm sure there's been conversations with community service, the board, before this process came to light. And I'm just wondering if there was a general sense or a feeling or an opinion among the members of the board about St. Lawrence County being involved with the chemical dependency portion, or if the feeling was that maybe it was time for somebody else to take that role over even before this process came to light.
Sherry, do you have any insight on that?
I don't have any insight into that subject at all.
So comments about the hospitals, I have not seen it, the layoffs, but many hospitals are laying off because people aren't taking elective surgery because of the COVID. I mean, that's happened right across the nation, I think,
Right.
this terminology. So, well, I think it's important to know that everyone that was doing the scoring ranked St. Lawrence Health Systems as first. Two of the individuals had the St. Lawrence County tied, but all the elected St. Lawrence Health Systems as their number one. Any questions here? Mrs. Curran, Ms. Curran, I'm sorry.
Hi. So I would say this, I would say that the purpose of the county is to do something that private business cannot. In this instance, we have a private business that wants to do this. I understand their thought process about the mall because it puts them in a place where there's another clinic that people can come and go out of. So you're not necessarily going to the mall to go to get your OTP. You could be going to the Veterans Administration. You could be going to the new physical therapy place that's going in there. You could be going to the gun shop. They don't know when you go in that entrance who you're gonna go see. So it gives people a little bit of like privacy in why they are going to the mall. I know that it would be a new build. I know that the builder would be the same builder whether they build at the site in the mall or if they are the builder that builds at the place in Messina. But I know that I've heard from a lot of the people that are interested in this program coming to Messina, more worried about having to go to the DMV site because everyone will know they're going to get their own drugs.
And that was brought up during the discussion to a certain extent. So Mary, do you have any comments, further comments that you'd like to make about the presentation?
I think that this is, for me personally, it was a frustrating process, knowing that the county, had worked hard on this. I think that I would say I recognize that we needed more guidance on this. If the expectation was that we were gonna interview the participants and that's what the county's expectations were, that would have been nice to have that because we didn't have that. I felt having Suzanne Levine there to answer any questions was incredibly supportive. We obviously couldn't invite Jay. It was equally helpful to have Kevin there asking the questions. Should we have done it differently? Clearly, the board feels that way. I don't know what else to say.
So,
I think that they made their decision, and it was a group. It was the board. The board was making the decisions, not me.
Okay, we have a question from Mr. Reagan.
Just a comment. I just want to thank the Community Services Board. I think whenever a board is put in the position of choosing who is going to be awarded a contract of this sort, there's always going to be second guessing, and I think it's very important to note two things. One is that St. Lawrence Health Systems is not a private entity in the sense of a profit-making entity. It's a not-for-profit. It's also the single largest healthcare agency in St. Lawrence County. And it has the ability to recruit professionals, bring, you know, staff in, and it's got a management team that is able to tread and, you know, figure out problems and address them. One of the things that we were told by the folks at Credo is that, you know, their first year operating this program was a very difficult year that saw huge problems in administration, huge staff turnover, just a host of problems in administering, you know, a new program. I think bringing St. Lawrence Health Systems into this is going to help ensure that, you know, you have a administrative staff overlooking the whole thing that can address those problems and has the wherewithal to bring in professionals to address those problems. And since they operate 3 hospitals in the county, Governor, Messina, and Canton Potsdam, and agencies and clinics in many of the other communities, I'm sure that the reason why the Community Services Board made this choice was because, you know, it provides an opportunity to get the word out and get involvement from a lot of health providers across the county. And I think that the real purpose of us going into this new business is to provide a service that we haven't had and provide a new tool in the box of our healthcare professionals to help prevent these needless deaths and help these individuals who, you know, currently are destroying their lives and the lives of their families and everyone around them. And I think that we need to focus on those people, make a difference and improvement in a area that nothing else has worked. And I just commend the Community Services Board for what they're doing. And I don't think they should draw from this evening's meeting that the entire board feels that they've done something wrong. I think they've done what we asked, and by opening the process up, we had an agency that no one saw coming, that no one had any idea was interested in this, and that has the resources to make this thing work. Thank you.
So just to comment, before we ask Mr. Forsyth, we were actually really disappointed with St. Joseph's application, or their proposal, because we knew that they were one of the entities that was interested before. And so the depth of it was really quite shocking. It was really contingent on whether or not we got the federal grant of $900,000, because in the second paragraph, that's what it basically said, that, well, it didn't come right out and say, we're not going to offer the services if you don't get the federal grant, but that was the implication. And I think what impressed people about St. Lawrence Health Systems was they already were treating 1,280 individuals in some type of addiction mode, and that they had a medical director, that they were providing security, and that the location was in Messina, not in Canton or Potsdam or wherever else. You know, it was the place I thought that I think this board actually, when we talked about having a service in Plattsburgh, in Watertown, that Messina was geographically about the middle. So I think that was what some of the strengths was, that they had the ability with the expertise and the staff that they had to offer a full circle, whether it was addiction combined with mental or whatever. So, Mr. Forsyth.
Yeah, Mary, I want to thank you and your board. I know a lot of things, you're volunteers, and I know a lot of these things are thankless, but I appreciate it. Rita brought up a point that's always my main focus. If a private sector can do it as opposed to government, I will support the private sector. But the one thing we're not hearing a lot about, and what I made my statement originally, was the care. Do you feel comfortable, do you as a board member feel comfortable that San Juan's health system can provide the care that's going to be needed?
I think that with any grant proposal, that's always up for grabs. I think that they have the potential to do that, just as St. Lawrence County. It's on how they deliver the goods. Do I think they can do it? Yes.
Yeah. And to me, being an outsider looking in with no experience in any of this, I support whatever decision that board comes up with. So thank you for your efforts, and I appreciate it.
Okay.
Thank you.
Go. Mrs. Haggard?
I just want to clarify that I don't want to be categorized as not appreciating the work that a volunteer board does. I'm asking questions and supporting people in this specific thing. I know some people on that board and I appreciate it too. So I don't want any generalization made that we don't appreciate the work that you do. Thank you.
Yeah, thank you. So John? Mr.
Yes, Jay, if Jay's still on, I'd like to ask him another question.
I'm here.
Okay.
Jay, what impact will this have on St. Lawrence County operations as it now exists?
Well, I mean, we've identified approximately 30 to 40 patients, you know, and I haven't talked to Shana Smith recently, but it was about 30 to 40 patients that were on Suboxone that were not stabilized and doing poorly that would benefit from this higher level of care. So, you know, in doing the ethical thing, once this OTP is up and running, I'm not sure when that will be, but once it hopefully is up and running, you know, that we will make the referrals, you know, to the appropriate level of care. You know, those folks that are on Suboxone typically, you know, they have peer services, they have groups, they have individuals along with prescriber services. So, you know, they are certainly, you know, kind of the highest level of need, you know, in terms of not only care, you know, but also, you know, the provision of billable services. So, you know, given the fact that we're already struggling with our production, if we lose, you know, that segment of population, you know, sometime down the road, it will certainly impact, our stability.
And Jay, on just one other question on the in Potsdam Hospital's application, they had indicated on the dosing that it would depend on the patient's progress and treatment. What does OASIS regulations state?
Well, I mean, certainly the first 90 days, it requires, it requires daily dosing, you know, for the first 90 days. So it's not based on, what they purported. And then there's also from there out, you know, there's a little bit of a matrix, like a Rubik's that OASIS has in terms of the dosing and so forth. And Shana Smith, that she's on, she has, you know, more knowledge of what that looks like. But I mean, it's because of the nature, you know, of the medications, if somebody gets to the point where, you know, they appear stable and have the ability to take home doses, there's fairly serious implications with that, and it's looked at, you know, fairly closely by both, the agency that's providing the medication, but also OASIS.
What's the gold standard for dispensing medications in this clinic? Because that's at the heart of the issue. What is the gold standard for dispensing methadone?
Well, it would be a methadone pump, a pump machine that's hooked into an electronic health record. So when a client, they're given an ID number and you punch the ID number in, from the electronic health record, which is synchronized to the methadone pump, then it automatically, dispenses that dose per the patient's case record or electronic health record.
And if I'm not mistaken, St. Lawrence Health System proposed dispensing the methadone tablets as opposed to the pump. Did you have a chance to read their proposal after the fact?
After the fact, I did, yes.
Is that what you read as well, Jay? That their proposal is tablets and it's a cumbersome process?
Well, it's an antiquated process, yes.
And one other question on the security, because they were ranked high on the security for having 2 security guards. Now, we had 2 presentations, one from Credo and one from Catholic Health Systems. What do they employ, Jay?
Well, Credo has, I believe they have 1 security guard during the hours of operation, my understanding. The Catholic Health Systems, they have 1 main clinic that's in downtown Buffalo, and they have a security guards there. But there are other clinics that are more similar in size to what we're proposing. They do not have security guards.
Right.
Okay, we have a question from Mrs. Curran. Turn on your mic.
Oh, sorry. Jay, can I ask Jay a question?
Certainly. We're gonna wrap this up here pretty soon.
Where Credo does this in the Waterville, Oswego area, they don't have that methadone pump. They do it the antiquated old way with the book and the little mark cabinet and all that, right? That's what my understanding is.
Credo? No, they have a pump.
Do they? How many patients do they have?
Well, no, I think they're upwards to maybe 250.
I think as long as people get the OTP.
Right. So anyway, Mary and Sherry, I want to thank you for your presentation and your time and your effort in this endeavor. And thank you for coming.
Kevin, before you close, I'll ask for somebody else's time to ask additional questions.
Well, we're going to move on. We have executive session that we have 4 categories, John. John, you've had plenty of questions. We're going to move on.
I'll ask somebody to yield their time to me.
So I would entertain a motion to go into executive session. Moved by Mr. Lightfoot.
Point of order.
Second by Mr. Forsythe.
Point of order.
Yes, what's the point of order? Yes, what is it?
You didn't finish old and new business. Ask if there was any other old or new business.
It's not listed on my sheet, Mr. Perkins.
Yeah, number 11 is old and new business.
Right, okay. So, yes.
It's quick. On the county website.
Let me ask for the individuals going to executive session to withdraw theirs.
I'll withdraw.
They both have withdrawn. Go ahead, Mr. Perkins.
And maybe this is for Ruth. The county website on the DANK web mapping portal, you can't log into that anymore. You have to be a client. Is there some reason that people can't sign into that anymore?
I can check on that for you, Rick.
Thank you.
Rick, I was in it over the weekend. I could get to it. It's like it hesitates or something. You hit on St. Lawrence County.
Yeah, I'm on the DANK and you have to log in. The only place I got, you have to log into it, and I didn't have a sign in.
Look down in the far right-hand corner. There's a spot that says St. Lawrence County.
Okay, I'll take a look at it.
Hit that, and then it'll ask you. Then it'll be there's an advanced St. Lawrence County thing.
Okay.
So
thank you.
I was in on it Saturday and Sunday, I think.
Rick,
So-
Rick, what are you accessing it through? Are you going through Chrome, Google Chrome, or Internet Explorer, or do you know how you're trying to access it?
Oh, it was probably Internet Explorer.
Okay.
Probably not supported.
But were you going through the county website? Is that how you accessed
Yes.
it?
Yes.
So when I did that, it was a little tricky. It took me a while. If I just plugged in St. Lawrence County portal map, it brought me there quick. It brought me to the Dank site quicker.
Maybe we
So-
should have an easier link for it.
I
Okay,
think
thanks.
something. Okay. So Mr. Lightfoot, executive session?
New
And-
business. You can't move on. I have more new business. Like it or not, Akers, I have more.
Mr. Denisha, yes.
Chairman, I did have some more old business.
Okay, so we will, yes, go ahead, John.
I want to ask the question about our DSS and our staffing. I'd like to know the criteria for which children are placed into care, foster care. What that process is and where we stand with the people that do that. The staff that are needed to execute that. We've gone from 155 in 2015. We're at approximately 320 as to today for children that are in care. And I'd like to get a status report on how we're doing with the staffing. I know we've had 100% turnover in attorney staff in a 9-month period of time, and I'd like a status report.
John, how would you like that?
Pardon?
Would you like that at the next meeting or by email prior to?
Well, I guess here's maybe I'll just make a statement, Ruth.
Sure.
You know, I think my understanding, we're at 50% staff in our legal department, and both of those individuals are one very capable, the other's capable, but both new, and the challenges are great, and I want to know, I'd like to have a good idea that the process that we have in place for the safety of children is secure, and that the resources that are needed are in place. And again, that's, and I have a number of other questions about that as well. I mean, we can talk about it at a different point in time, but I think it's important for people to remember that children are removed and placed in care because they are in imminent danger. That's the criteria for children to be removed. We've gone from 155 to approximately 320 since 2015. In the past 7 months, or less than 7 months, we've increased by 18 or 19%. You talk to most teachers when school resumes and you have that traditional reporting system, there is an expectation that volume will go up. So I'd like to know our readiness for that. I'd like to know how we stand at this point in time.
Okay, I can pull that together for you.
Mr. Denisha, you have some new business.
No, it's old business.
Old business, okay, go ahead.
One question.
Yes.
Thank you, sir. Same question I've asked for the last couple of months in regards to people that are unable or having a difficult time paying their installments, their taxes. We've talked about this, we have not come to any resolution. And county treasurer was going to let us know how many people were affected by this. Anecdotally, I know a couple different folks that have been affected by it. One to the tune of a $500 penalty. Through no fault of their own, were they, unable to pay taxes. It was, they were impacted by either the tax collector not being available. It's COVID related. And I do not feel that it's right. I don't think it's the right thing to do. If anybody, as I said before, if anybody has been unable to pay their taxes because of reasons beyond their control, specifically COVID, we should not assess any penalties or fines. So it's you got a couple individuals, Larry, or somebody, I mean, you don't have to. There are a couple, yes. Okay. So I don't know what it would take for, if the reason was that the tax collector was not available, it wasn't a monetary issue or? No. Okay. So I don't know, how do we handle that? Had the money, couldn't pay. Wouldn't be able to. Okay.
Let's give them the options again.
Yeah, we'll have to find out. That's a good point.
Yeah, we can do something. Yeah,
Okay.
we'll talk with you after about that. Is that all right?
Okay.
Get more information. We'll bring it back.
Okay. Any older or any more old or new business? Mrs. Haggard, is this old or is this new?
It's neither.
Well, this is an old and new category. Come on. Neither. Okay,
Tony,
go ahead.
Okay, Tony got kicked off because of power. Is there any way he can phone in, or how do we handle this?
He phoned in to let us know that he had no power the first time, but we haven't heard from him since.
Well, I just asked him on a text what happened to you because he dropped off, and I was hoping that somehow, I don't know, what do you do in this situation?
This is brand new for us.
No, I had it happen.
Oh, you had it happen? What did you do?
I couldn't call him.
You couldn't
I did call him. Yeah.
You did call him.
Call back number.
Dylan's gonna give him a call right now.
Yeah, there's a callback number.
Yeah.
I did have to call him.
So Dylan's gonna call in.
Great, thank you.
Okay.
Executive session, please.
Motion by Mr. Lightfoot for executive, seconded by Mr. Forsythe and Ms. Curran. Any discussion? All those in favor signify by saying aye.
Aye.
Opposed, motion carried. So to entertain a motion for adjournment moved by Ms. Curran, second by Mr. Reagan and Mr. Fay. Any discussion? All those in favor signify by saying aye and goodbye.
Aye.
Bye.